Hold on one second. Let me. Good morning, everyone. Good morning. Thank you so much for joining us.
Good morning.
Good morning. We'll get started momentarily.
Morning.
Good morning.
Good morning.
Good morning.
Good morning, everybody.
Good morning to you.
Good morning, Andre.
Good morning.
Good morning. It's so great to see everyone. I'm so glad so many people could join us. This is fantastic.
Okay, hold on. I'm gonna ask Megan. Hello.
Good morning. I'm just going to mute everyone for now, if that's okay.
At the test of the same grant for this classroom.
Morning. Good morning, everyone. We're going to get started in just a minute. We're just going to let a little bit more people come on in. Good morning. All right. We'll give it one more minute and then we'll go ahead and jump right on in. It's so great to have so many people this earlier in the morning. All right. Well, we don't want to keep everyone waiting, so we'll go ahead and jump right on in. Good morning, everyone. So happy that you can join us on this Friday, March 24th. For our institute, addressing career counseling and employment needs, prioritizing the physical, mental, and economic health and well-being of people living with HIV, Part 3. So this has been an ongoing partnership between the North Carolina Central University Counselor Education Program and the National Working Positive Coalition, which we'll talk a little bit more about. But we're so excited to offer Part 3. Parts 1 and 2 over the last couple of years have been dynamic. So we're excited to come back to learn more and to train together. We have people joining us from all over. If I could just, I wish I could count all the states that people are coming from. But we're all over to come together to learn more about this very important topic. So thank you for taking the time to be here. My name is Dr. Regina Gavin Williams, and I have the privilege of co-sponsoring and co-hosting this program with the National Working Positive Coalition. I am an assistant professor in the counselor education program at NCCU, and I also serve as the director of the career counseling program. So very excited to partner with Mark for this training institute. And then we'll move to the next slide. So just some housekeeping things. We want you to make sure to enter your first and last name as your Zoom when entering the meeting. And the reason why we do this is because we want to make sure to give everyone appropriate credit. If you're here for any kind of CEU certificate, whether that's through NBCC, whether that's a CRC, we want to make sure that you get your credit. So if you don't mind changing your name to your first and last name, that's going to help us readily identify one, who's in the room, but also to connect your time here with us for those CEUs. So thank you for your attention to that. We are we are recording this training event. So just know that we're going to video and audio record. So we ask that you please mute yourself when you're not speaking. But we also want you to use the chat feature to ask any questions or make comments and share information, as well as we would like for you to use the raise hand function or any reactions to come off of mute. So if you do want to raise your hand, if you do want to speak and unmute your mic, just use that raise hand or the reactions to come off during that time. That's specifically going to be important during the Q&A and also the discussion as well. And we do have closed captioning available for those who will need that. And also, we're going to ask you at the very end to just please take a moment after this webinar to fill out our evaluation. We want to know how you received all of the information during our training time together. It's also going to help us, again, readily identify those folks who need CEU certificates. So you need to fill out the evaluation in order to get that. And then just overall, whether you need the certificate or not, we just value and greatly appreciate your feedback. So please do that. All right, next slide. All right, so a little bit more about our continuing education units very quickly. For those who are in need, we have up to 4 hours or credits that are going to be provided for those who pre-registered. And those are in the areas of the National Board for Certified Counselors for NBCC, and also those for the Commission on Rehabilitation Counselor Certification, or CRC. So depending on how you registered is how you're going to be able to get which particular certificate. Again, up to 4, and we will need for you to complete the post-training evaluation survey with your name and your email address on that particular evaluation in order to get those credits. Next slide. And here's our agenda for today. So we have an action-packed agenda. It's going to be so great. So we hope that you can stick with us throughout the duration if your time permits. Starting out with the opening and welcome, I do want to share a little bit about the keynote speaker. Our keynote speaker, Benita Ray, unfortunately is sick and won't be able to join us today. So we do wish her a very speedy recovery for this time. And so unfortunately, she will not be able to join us. However, we do have another dynamic person, Martha Cameron, who has graciously agreed to give us some opening remarks. So we'll be hearing from her very shortly. We'll have a panel following that, panel 1 on employment-related needs and strategies unique to lifetime HIV survivors or people who acquired HIV at very young ages. Following that, for panel 2, will be the role of employment and employment services in the journey of Black people living with HIV. And then panel 3 will be highlights from a 2025 research literature review project, studies related to HIV and employment. So we will be doing those in succession of each other. I do ask that if you need to take any breaks at any point, we won't have any scheduled breaks. So just whenever you need to, feel free to excuse yourself and take that break and come right on back, because we'll be rolling through the duration of the afternoon until up to 1 o'clock. So please take care of yourselves as needed. Next slide. I just want to give a very special thank you to my program, the NCCU Counselor Education Program, for all of their leadership and support, and always allowing us to just go with topics that are near and dear with our to our hearts to better train our students as future counselors, this being one of them in the third year. So just a special thank you to the NCCU Counselor Education Program, as well as the NCCU School of Education. Most notably, our leadership, Dean Audrey Beard, our Associate Dean, Dr. Jeffrey Warren, our Department Chair of Counseling and Higher Education, Dr. Chad Royal, and our co-program coordinators, Dr. Peggy Whiting and Dr. Helen Lupton-Smith. Thank you all so much. For those who are unfamiliar with our program, we do train students in 3 different tracks: clinical mental health counseling, school counseling, and career counseling. And so our students are going out to be change makers with a very social justice oriented lens. So having institutes like this help them in their training and working with people in the field in our communities. So thank you again. All right. So it looks like the chat is already bumping, popping. I love it. I love it. I love it. Well, let's learn a little bit more about you. Just tell us now if you can enter your current location. Where are you coming from? Your town, city, state? Enter it into the Zoom chat box. We just want to see where everyone's coming from and for you all to see with one another as well. So you could just take a moment to do that. Where are you located? Let's see here. We got Denton, Texas, Cook County, Springfield, Illinois. Yes, University of Chapel Hill right down the street. All right. Center for AIDS Research, New Orleans. Okay. Wayne, Indiana, Chicago, Elizabeth City State, one of our other neighboring institutions close in our state, Connecticut, Columbia, South Carolina. All right. All right. We see Puerto Rico. Okay. Yes. Decatur, Georgia. I'm from Georgia, from Jonesboro. Love it. Thank you all. Let's see. Iowa, North Dakota. Wow. New Mexico. This is really great, everyone. Awesome. Okay, so while you're putting that in, the other thing we would love to know, if we can click to the next slide, is I'm going to launch a quick Zoom poll. If everyone's familiar with that, it's going to pop up on your screen in just a moment. And I want you to please choose one or more of the below to identify your current role and or work, because we want to see who's coming from our audience. I'm going to launch that. You should see it up on your screen now. And click one or more. We want to see where our audience is coming from today. While you're doing that, I see Atlanta, Georgia. All right, student from Medbin currently in Atlanta. Awesome. Good morning. New York, New York, Charlotte, Brooklyn, Illinois. Okay. Murfreesboro, Illinois, LA, California. Nice. All right. Do we have any more people who want to participate in our Zoom poll? We'll give it about 30 more seconds. Okay, it ended. All right. So, looks like we have, everybody see our results here? 58%, we have a lot of vocational rehabilitation counselor administrators here. Okay, we have college students. I know that not everyone got a chance to participate in the poll. That went really fast. So we only got about 53%. But we do have people represented from college students, college university professors, counseling service provider administrators, HIV service provider administrator, HIV advocates, vocational rehabilitation counselor administrator, and other. All right, thank you for participating in that. All right, next slide. All right, now I'm going to pass it over to Mark to introduce the National Working Positive Coalition.
Thanks so much, Dr. Gavin Williams. I am so deeply appreciative of this incredible opportunity that we have had to partner with NCCU. And I just want to say, if anyone ever comes across the potential opportunity to collaborate with Dr. Regina Gavin Williams, do not let that opportunity pass you by. It has been just a tremendous privilege, and I'm so grateful. I want to welcome everybody and thank you all for joining us here this morning. I see an extraordinary range of expertise represented in our group of attendees in this Training Institute today, and I am humbled and deeply appreciative. I'm super excited that all of you have joined us today with this incredible group of experts and leaders from across the country that have joined us today to share some of their own observations, their insights, their experience, share some of their own stories. There's a remarkable opportunity today that I am deeply appreciative of. I want to just say a couple of words about the National Working Positive Coalition. I serve as the executive director of the NWPC and do so with the privilege of working alongside Sylvester Askins Jr. as our training director, Heather O'Connor as our communication specialist, and alongside Vanessa Johnson, who serves as our board president. The NWPC works to strengthen responses to the employment needs of people living with or at greater vulnerability to HIV. And we have been around for a little over 20 years. We were founded in 2003. I am in this moment, which is so fraught and challenging for so many of us, deeply appreciative of the opportunity for this work to help strengthen the responses to needs that have historically, quite honestly, throughout the course of the HIV epidemic, been marginalized. The work that we do includes serving as a central resource at the national level for HIV and employment information, research, capacity building, and technical assistance. And I very much welcome any and all of you to connect with us. Let us know how we may help support and encourage the work happening in your communities and help in support of any opportunity to assist people living with or at greater vulnerability in connecting with the services, the information, and the resources they need to pursue employment. Next slide, please. I want to really take a moment to express our deep appreciation to ViiV Healthcare and their Positive Action Community Grant, which has helped make our work on this virtual training institute possible. And with that, I will just say I'm so deeply grateful that today we will have a chance to hear some of the stories and some of the insights that have too rarely been spotlighted across the history of the HIV epidemic. And I'm deeply thankful to NCCU for making this possible. And I am truly awestruck to see that we now have 100 people that have come together today to try to make positive change happen collectively. And please keep me posted how I and the National Working Positive Coalition can support that effort. And as I turn it back over to Dr. Gavin Williams, I'll put my contact information in chat and welcome folks to let us know how we may help support your efforts. Thanks so much.
Thank you so much, Mark.
Next slide, please.
Oh, if we can go, there we go. All right. So I talked about this just a little bit earlier, but we asked that you complete the evaluation survey at the very end of our time together. There is a QR code to scan. I'm also just going to drop the link in the chat so you have it there and just keep that handy. Let's see, I don't know if I can pin it or not, but that is the link to the survey. So I'll just give you a moment, and this will come back up at the very end, but I'll give you a moment to scan that or keep the form handy so that as you go through our time together, you'll be able to fill out an evaluation for that. All right. Okay, so hopefully everyone has that. We'll give you just a couple more seconds to get that. All right, thank you. We can move to the next slide. Okay, so today with us, we have Martha Cameron, who's going to give us some opening key remarks. Thank you so much, Martha, for being with us. Martha is a research specialist for Georgetown University. She's also the director of the International Community of Women Living with HIV North America and the commissioner for Washington, D.C. for the Regional Planning Commission on Health and HIV. And I was told that this is just a snapshot of all the things that Martha Cameron does. So thank you, Martha, for being with us, and we'll turn it over to you.
Thank you so, so much for having me this morning. And I think Mark has already said that I am stepping in or filling in for really, really big shoes. Vanita Ray is an amazing HIV advocate who is currently the chair of the People Living with HIV Caucus, of which my organization and NWPC and many other networks are a part of. And also works in the South, where we know that HIV has deeply impacted folks. And so just a big shout out to her. And I want people to acknowledge I am feeling very big shoes. So really excited to be here. I have been, I think, to every one of these sessions as a panelist, as a staff of NWPC, where I served for a year, as Mark's deputy before I had to go back to school and work in research at Georgetown University. I have also been an executive of the International Community of People Living with HIV, which serves women living with HIV here, and we have 10 regions around the world. But I think what hasn't been said here is that I am also a person living with HIV. I was diagnosed in 2003, and I was diagnosed in Africa, a country called Zambia. Sometimes I find people know where it is, and sometimes people don't. But it's located in sub-Saharan Africa, which was heavily impacted by the HIV and still is impacted by the HIV epidemic. So when you see me here today, I can wear multiple hats. I am a Black woman living with HIV. I am an immigrant living with HIV. And I can go on and on about those intersecting sort of personalities that really, really lent to this idea of being a woman or being a person living with HIV here in the US. I don't represent everybody. We have so many different populations that are impacted by this epidemic, LGBTQ brothers and sisters that were initially heavily impacted by this. The Black community at large is heavily impacted. And then we know that a lot of us living with HIV live under a federal poverty line. It is true that all the health disparities that probably predisposed us to HIV in the first place really, really continue to make us vulnerable. But I wanted to spend a little bit of time, and I'm using every opportunity I get to talk about the unprecedented times that we find ourselves in. And I take this opportunity because, as Dr. Regina said earlier, we have an amazing group of people participating. We have the vocational and rehabilitation counselors. We have counseling students, all of which may be a touch point of people living with HIV either now or in the future. And the things that are going on now in our world deeply, deeply impact people living with HIV. But I think the other part of this is that what is going on now is indiscriminately impacting everybody. Everybody. The world changed in January, and there's so many things that have been happening day to day. But most recently, something that we have to be really aware of that we as a community are fighting right now are these amazing, amazing attacks on our community. And they are coming in many different forms, right? We have heard about the executive orders that impact even very specific communities in a way that demonstrates, for lack of a better term, hate. We have all these Dodge firings. We have a reconciliation process and appropriations process in the federal government that is absolutely about to disseminate healthcare as we know. It is important that as we are thinking about people living with HIV, and I know this is especially associated with employment, that many of us who live with HIV face different disparities. And so I speak especially to those people that may not already be working in HIV about how important it is for you at this moment in time to stand alongside people living with HIV, the LGBT community, and Black folks at large, right? Excuse me. So I just want to zoom in. Oh, excuse me. Sorry about that. So our federal government is looking to cut about $800 billion. And the only way they can do that is by disseminating Medicaid, which is the largest public health service that especially serves people living with HIV, right? This means that there'll be a restriction in eligibility, services, and benefits. Our healthcare systems will be overburdened. And this is simply because even though this money is being slashed at a federal level, it is sent to our states, and the states end up really having to bear, and they can't be able to really match what has been given them to the states. We're looking at racial, gender, and even reproductive health injustice. We're looking at structural violence that is happening against the LGBTQ community. And we're looking at hospital closures, especially in rural areas where some of us might find ourselves in. And most certainly, we might be looking at a loss of coverage for people living with HIV in our communities. This has already happened globally. Like I said, I'm wearing a global hat. So you've heard about how USAID and PEPFAR have been shut down. And these two programs have served people living with HIV globally for over 30 years. And in some especially poor countries, this can be a very huge impact. And let's not be sort of misinformed. They try to show as if the money that goes to some of these African countries is a huge amount. It is less than 1%. It's about 0.7% of the entire budget that goes. So it's not a lot. We know that Medicaid covers 1 in 5 people everywhere. And in some places, it's more than others, especially for those of us that may be located in the South. It covers our prescription drugs, inpatient and outpatient care, and essentially, it really improves health outcomes and protects people from medical debt. So what is really, really going on? What we're seeing we haven't seen, a lot of people are even referring back to when this administration was there a few years ago, but we can go all the way back to the first and early days of HIV in the Reagan administration, when they wouldn't even say HIV. Nobody would say HIV. This is a huge attack. And we would go back to the days when we saw people die, when especially there was a lot of discrimination for the gay community, but this has expanded, of course, to the larger LGBTQ community, and we cannot stand by and watch. For all of you as counselors, vocational rehabilitation, I know you end up working in different places, in different hospital healthcare settings, but I really do want you to know that this is going to impact all of us, and we are trying to rally an army to protect Medicaid, not just for people living with HIV, but to every person that deserves healthcare here and globally. I know I spent a lot of time on that, but right now we are in a crisis as the people living with HIV community. And we need to rally support from every corner. This is not just about our community. We need every community. Medicaid serves those who are disabled. Medicaid, in places where it expanded, has allowed younger folks to stay with their parents on insurance. It has really helped people to have access to healthcare. And like those early days when you would literally have to be on your deathbed in order to get onto Medicaid. And what we might see happen as well, and this is something we're fighting against, is that folks who are already impacted in many different ways as we age with HIV, with comorbidities and other disabilities, is that they might enforce work requirements, for example, on people living with HIV. And for you guys as vocational rehabilitation counselors, this would be really key. We have wanted and support people going back to work for those that are able. Later on, you're going to hear about models that have, set up a framework in which people can go back to work as they are able. But on the flip side of that, we want to make sure that this does not disqualify them for their eligibility to get health care. And so, if you go away with anything from these few remarks of mine, is to really understand that our community is in crisis right now, and we are rallying the troops. We are forming coalitions with people that are not just of the people living with HIV community. We're forming coalitions with anybody and everybody. Knock on your neighbor's door, knock on anybody's door, and have them understand that Medicaid will impact everybody, but especially those folks living with HIV. Let me kind of finish on a happier note. When I first came to this country and wasn't necessarily eligible for insurance, I accessed the Ryan White services. The Ryan White services are provided by the federal government as well as a payer of last resort for people that are unable to get any kind of insurance. So for the first few years of me being in this country, I was able to get Ryan White services. And not only was I able to do that, I was also privileged to work with an organization called the Women's Collective in DC that served women living with HIV, and especially Black folks living with HIV. And I was struggling then. I was, wondering, how am I going to make it in these, American, how am I going to make it in this American country? How am I going to pursue this American dream with all these hats that I wear, a dream that is, looking very far off. But when I was at the Women's Collective, I wondered, would I be able to go back to school? Will I be able to get a decent job? And it was then that I actually ran into Mark at a conference, and he was talking about all these amazing possibilities for people who have been living with HIV, may have been sick at some point, but could take certain steps to come out of whatever status that they were in, to be able to seek employment and to be able to even go back to school, that there were resources available for people living with HIV that I had no idea that were available. And I felt really, really inspired by all of this. Not only was I able to go back to school, which I never ever thought I would, but I was also able to get some really amazing different kinds of employment. I was able to come out of the paying rent, and I was able to purchase a house with my family. I was able to do things that I never ever thought I would do, knowing that there is actually a process that is guided by counseling. Although in that time, I really relied on every little word that came out of Mark's, workshops and teachings and so on. And I find myself here. And I was really privileged to then later work for, National Working Positive Coalition. And I will forever be an advocate of trying to empower people living with HIV to understand that they can do it if they're able to go back to school, to get better jobs, to ease out of unemployment and disability and make their lives better. And especially in this environment that we find ourselves in, I think this is going to become so critical. And therefore, your jobs, especially as counselors, are going to become so critical to encourage us, to motivate us, to help direct us back into a place where we can ease out of some of the situations that we're in, have an income, and be able to support ourselves and our families. And so I'll always be an advocate for the National Working Coalition. And I trust that you're going to learn a lot today from some of the amazing panels that I've seen here that will help you in your counseling and vocational rehabilitation journeys. Thank you so much for having me. And I look forward to hearing what else we have today.
If we could just give a virtual round of applause to Martha Cameron for gracing us with this information this morning in these opening remarks. We greatly appreciate you for not only being open to sharing your own lived experiences, but also just allowing counselors and future counselors on this call to really recognize and understand the importance of their work in supporting people who are living with HIV as it relates to counseling and career services and employment in similar ways that you were able to gain and be successful in where you are and where you're situated today. So we're happy to see that, and also to just share some insight as to what we're facing with the current administration as it relates to services and support for people living with HIV. I think it's important for us to be aware of that. And so I'm looking forward to more insight from the panels as well. But thank you so much for your words this morning. Awesome. For those who are just joining us, I'm just going to remind everyone in the chat just to change your first and last name on your Zoom. That's going to allow us to, again, give those who are registered to receive a CEU certificate that we know who we're giving it to for NBCC or CRC. So I made that reminder there. And again, we want to encourage throughout our time today to drop questions in the chat, drop insight or remarks that you may hear that may be insightful to you. We want to encourage you all to have that voice. So feel free to respond in the chat or raise a hand throughout our time today. So thank you again. We're going to go ahead and move forward with our very first panel. So if we can, there we go. All right. So our panel today is going to be, our first one is going to be entitled Employment-Related Needs and Strategies Unique to Lifetime HIV Survivors or People Who Acquired HIV at Very Young Ages. I would like to welcome the moderator of this panel, Antoinette Jones, who's the co-founder of the Dandelions Movement and National Field Organizer for Positive Women's Network USA. Antoinette will then introduce our panelists, and we will have until 10:45 for this panel this morning. Thank you so much for being here.
And we do not have Antoinette with us,
Oh,
and Martha Cameron has graciously
okay.
um, offered to help facilitate this very special panel, which is in no small part happening this morning. Is in no small part happening this morning because of her efforts to help bring
Oh,
attention to the very unique experiences and needs of lifetime survivors and people who acquired HIV at very young ages. We have Omar Cintron, Charna Teasley, and Mars Albaran. I think
Yes.
if we can get
No,
those
no,
folks.
Charna Teasley is on the
Oh,
next.
I'm sorry.
No.
That's
yeah.
right. Wrong
It,
Okay.
panel.
and it looks like
Uh,
Antoinette actually
Has
just
joined.
joined us.
Yes.
Yeah.
Awesome. Awesome.
So
oh,
I will.
great.
Process, not perfection, y'all. We learned that during COVID,
Yeah.
right?
Right.
We sure did. All right. Wonderful.
Yes, yes.
All right.
Trying to bring her on. There she is. Okay. All right. So we can go ahead and hand it over to Antoinette. Antoinette, are you cool to hop on in?
Hey everyone, I am not cool to hop in. I may have read the email wrong. I just assumed our panel was at 10:15 or to be on by 10:15 so we
I
can start at
got you. I got
10:45.
you.
And I just dropped my baby off at school. I'm so sorry, but I'm
That's
just
all right,
like I'm
Antoinette.
frazzled.
Don't worry. Don't worry. We got you. We got you. And so what we'll do is we can go ahead and start the panel. And what we'll do is we'll actually have the panelists introduce themselves. And that way that will help us get started. But I am always, always just inspired by our dandelions. I have 2 children that were born since I have been HIV positive. And that was due to amazing research that came later. But I am inspired, just always inspired by the lifelong journeys and stories of our dandelion. So I'll go ahead and we'll have the folks introduce themselves. And so why don't we start with you, Omar?
Hi everybody, I'm Omar Cintron. Yeah, I was born HIV positive in 1989, so it's been 35 years living with HIV, and I'm just here to learn from everybody and tell you some of my stories.
Awesome. Awesome. And I'm excited to hear your story. Kimberly, I'm just going around on my screen. Do you want to go ahead and introduce yourself?
Sure, no problem. Good morning, everyone. My name is Kimberly Kennedy. Everybody calls me Kim. I should have changed that, but I reside in Brooklyn, New York. Also a lifetime survivor. I am 38. I'll be 39 this year. I am the communications manager over at Dandelions Inc. I am also the founder of Conversations with Kim, where I explore reproductive justice with children, youth, and women, really breaking into the stigma and exploring what passion looks like and also pleasure within the body, something that we don't talk about. We talk
Right.
about sex, but we really don't talk about pleasure at all. So that's a little bit about me.
Oh, I cannot wait. Bring a little excitement. Go ahead, Dorothea. There you
Hello
go.
guys, my name, can y'all hear? I can't unmute. Can y'all
You're
hear?
good. We can hear you. Yes,
Yes.
we can.
Okay.
Yep.
Hi, my name is Dorinthia, go by D, Unique. Most people can't pronounce my name, so I go by D. I'm the co-executive director and founder of Dandelions alongside with my one of the amazing person of here too as well. I am a mother of 3 biological, 4 in total. Um, yeah, I think that completes it for now.
All right. All right. And Mars, am I saying that correctly?
Yes, you are. Hello, everyone. My name is Mars. My pronouns are they, them. I am in the Albany, New York area, and I was also born with HIV. I am 36 years old. I'll be 37 in a couple of months. And as far as my work with HIV, I do a lot of advocacy work outside of my daytime job. My daytime job actually has nothing to do with HIV, so I'll leave it at that. But yeah, thank you very much. I'm excited to be here and excited for this panel.
Awesome. And then I'll just have Aisha go ahead and introduce, and then I'll hand over to the amazing Antoinette Jones.
Hello, I'm so sorry. My internet went out just as this is getting started. So hopefully if it comes back on, you'll see me switch back to my computer. So I'm using my cell phone. But my name is Aisha Scott. I work with the Dandelions Movement. I work with the finance and operations. And I'm really proud of the work we do and excited to be here today. Thank you.
Awesome. Well, I am super, super proud of all of you. It just warms my heart to even see this panel. And so I'm going to hand over to Antoinette Jones.
Am I not on the panel? No, Sharna, that was a mistake. You're on the next panel. When you see me, that'll be your panel, okay? Okay.
All right. Okay. Antoinette, over to you.
Thank
Take a
you,
deep breath.
Martha.
Yeah.
Thank you. Yes, I am deeply, deeply breathing right now. And I'm so sorry for the miscommunication, y'all. Hey, my name is Antoinette Jones. I am many things, but one of the things that I am in my current role is the co-founder and co-executive director of Dandelions Movement. I am also the national field organizer at PWN. And I am also a mother, somebody who has been in the workforce since I was 14 years old, somebody who identifies as the queer community, and so many things that I've experienced in my journey while living with HIV. I'm also born with HIV and have been living with it for 30 years. So I'm excited to have this conversation with these panelists today as we talk more deeply about the workforce, our experiences as people who are born with HIV, mental health, some of the needs that we need, and things that we want to see change when it comes to working alongside or in allyship of the Dandelion and Lifetime Survivor community. So my first question, I want to go to Kim for the first question. And then whoever would love to follow Kim and feels inclined to answer, please do so. But how has your experience as a lifetime survivor influenced your development of ideas about work, your career path, and your relationship with your work? Like, what has that journey been like for you?
Well, thank you for having me be the first one. um, get this out the way. So, how has that influenced my journey? So, I've started in the field of HIV at the age of 12. I didn't even know I was starting advocacy. I'm somebody who is known as an elite controller. Also, the old term was what was it, non-progressor. So for me, the doctor didn't understand. I'm also, born in '86, so in the early '90s, growing up, that was something that you didn't see. Somebody who was not on medication. Had a death sentence, but then again, the death sentence got pushed. So I started off talking with different doctors and going to conferences that way, just talking about my experience of living with HIV at 12. So at that, it kind of progressed where I wanted to know more about what is HIV. I'm talking about me and this experience, but I don't know exactly what I'm talking about. And I don't know, I know it's important, but why? So fast forward to after getting education, after doing street outreach, after um, having a double life because for me, I was the cheerleader at school, but then also I was the one that was always fighting in the streets as well. And then on the weekends, I'm traveling to Albany protesting with, other organizations on our rights and funding. And I decided to get those two merged. And that's when I became a person who wanted to talk more about what is missing with us, because I've been fighting for talking about what about us, what about what's going on with lifetime survivors. They done named us perinatals, we done had verticals, which I hate, absolutely hate. I think every panel I get on, you will know that I hate the term vertical. But for but for me it was something more than that. I didn't have anybody. Only person we had to follow was Hydea, and for may she rest in peace. But for me in New York, who was that person that we could follow? Who was that? I didn't want to be that person, and I wanted to be in that person until I kind of got tired and didn't want to do it anymore, and had to go back to school and learn, why did I want to do this and what's my passion. It's not because everybody else wanted me to do it, but because what is missing and what do I want to see. So basically, that's long story short, that's how I got back here. That's why I'm doing the work for lifetime survivors. And it's not for everybody else, it's also for me, because I think I lived a long time for working for my friends who died, who are no longer here. And for me, I had to leave, take a step back, learn the intricacies of what's going on internally to come back and actually do this work in a meaningful way. Sorry for being long-winded.
Oh no, you are perfect. And I love that you named that you were 12 years old when you got into advocacy. You like initially seen a social justice issue because you were looking for your peers in that process and you knew you had to do something about what was happening. So thank you for that. I'm actually going to go to Omar with the same question because I know you personally, Omar, you just recently got into public facing advocacy. So how has your identity of being a lifetime survivor influenced your ideas about work or your career path and your journey?
Well, I haven't done it as like work wise, but I would like to. Um it has like um right now, like trying to navigate through, like try to talk about it like publicly. It's a little bit, tricky because some people don't want to hear it, or like other people like don't care, especially as a male. So it's a little bit harder to get people's attention when you're a guy. So it's it's been okay, but it's just um it's been a journey. I would like to like find like some type of job with something like in terms of HIV advocacy, like because it's something that I would like to like know more and educate other people on it. And but like what I would like really like is like um educate others and like let people know that like people who are were born with HIV, because I have encountered like now that I'm a little bit public about it, I've encountered some people that did not know that you could contract it through birth. Like you was able to contract it through birth. So I would like to work on that aspect more.
I love that you named that, Omar. There are still people in 2025 who do not know that you can transmit HIV through the birthing process. So thank you for naming that and continue your process in your journey. I do see a hand raised, but I would love if we can just save questions for the end. or even put them in a chat so you don't forget. But I just want to make sure we hear from the panelists. Thank you. So Mars, same question. I heard you name that your work is outside of HIV, anything HIV. So how have you been able to navigate that, or how has your lifetime survivor identity influenced like your work and your career path?
Yeah, so this is such a good question. So for me, my story kind of begins similar to Kim's, although I did have symptoms and stuff and everything. So as a kid, I was in and out of the hospital a lot. But when I got to high school, there was this elective. You know, we have to take electives. There was this elective called AIDS Action Club, and I'd never seen a club at anywhere that was, you know, targeted on people with living with HIV and AIDS. And so I joined the club and was in it for all 4 years through high school. The first year we learned all about HIV, how it worked, how it was transmitted. You know, we watched a bunch of old videos to help us get the illustration of what HIV and AIDS would look, you know, looked like. But what was missing from our class was the human element. There, at no point did someone come and speak on their HIV experience. We volunteered at a local LGBTQ center, and we would, you know, create safe sex kits and things like that. But still, no one openly talked to us about their HIV experience. So sophomore year, I was 15 years old when I received my undetectable status. And so sophomore year, I was excited about it. I went to my teacher and was like, hey, can I share this with the class? And he was just a facilitator, really holding space for us. So he was like, if you want to. I'm like, all right, great. So I got up the courage to share my status with the class and share my story. And allowed the floor to be open for them to ask me questions and whatever it was. And it ended up being a pretty tight-knit group, pretty much the same people all 4 years. And so it started to feel like I kind of had like siblings or someone, you know, off in the corners. We were all from different classes. So I would see them in the hallways and things like that. And I never really experienced bullying or anything like that based on like my HIV status. And I really feel like part of that was because there was 10 other people who were easily able to advocate for me and what my story really was growing up. So that's really where advocacy began for me. I work for the New York State of Health contract, so where the marketplace for New York, where people get their health insurance. So there's nothing really front facing there. I work in learning and development. I write a lot of policies and procedures. That's my day job. So then outside of that, I really focus on my advocacy. So I'm a part of the HIV Stops With Me campaign. That's hivstopswithme.org. I've been on that for 6 years now. I'm also a part of the Lifetime Survivors Network and, you know, kind of try to participate there on any of the, you know, we have a support group going on and things like that. But those are really the places that my advocacy has gone. I had the privilege last year with the Lifetime Survivor Network to go to a lot of different medical conferences and things. And I've had the privilege of being on a lot of different panels and just having a lot of different conversations about lifetime survivors in a lot of different spaces. And so all that to bring us here to today. And yeah, again, I'm really happy to be here.
Thank you, Mars. I love that. I'm trying to think if I had a high school club that was really meaningful to and like connected to our community, and I don't think we did. So I appreciate your boldness and like sharing your diagnosis and allowing them to ask questions. I can only imagine the career paths they took after hearing your personal experiences. So thank you. Dorinthia, I see your face first. So, but how has your experience as a lifetime survivor, Dandelion, influenced your career path and the journeys that you took?
Like I said, okay, by the way, my journey was a little different from a lot of people up here. I didn't realize what HIV was until the age of 15, 16. Unfortunately, parents growing up, they was telling us not to say nothing. It was a solid secret in my household. Eventually, I got old enough to have the high school experience where I want to bring it back to Mars and how Mars said that they had the experience of being in clubs and things like that and being in front of people and being able to speak about their status and stuff like that. Actually, mine was a little bit opposite of that. Mine was I finally found out what HIV was. My status got around the school, and once my status got around the school, I became a no void to everybody. Basically, nobody wanted to talk to me. Nobody, because stigmas were still really extremely high. I had no friends after, and I didn't tell my status. I had a relative tell one of her friends, and her friends told another friend. And being in a small rural area of Georgia, everybody knows everybody, and this just little small little part was, oh, Dorinthia has HIV. Now I no longer have friends. No longer people want to talk to me. No longer want to be able to sit at the table at lunch anymore. So, of course, that was a traumatizing experience. But as I got older, I still had like this resentment towards HIV. Like I felt like my mom and my father was selfish, and I didn't get a chance to make a decision on my own. But however, God always have a place where I stood in, and as I got older, my journey began when I was in 2017, where I met my first dandelion. And unfortunately, I was going to an HIV clinic for the absolute longest and not know that I was going to an HIV clinic. Nobody ever told me that that was the clinic for infectious disease. People that are diagnosed with HIV. I'm sorry about my background. My cat had kittens and they're kind of loud. I'm sorry. But however, they did, I did meet this one specific person, and that was Antoinette. And Antoinette was the first person I was like, oh man, there's somebody out here like me. Growing up and having friends, and nobody knows what it feels like to have HIV. And finally finding someone that kind of could understand and put themselves in your shoes, literally in your shoes, and you could put yourself in theirs, and it was just such a breather. So my advocacy started with Georgia Equality, with the Youth HIV Policy Advisory Board, where we talked to the elected officials, where we did a policy brief to change the laws in Georgia to intent to transmit, and it sat on the desk of the elected officials for a while, but we was the last cohorts to get the laws changed in Georgia. However, we did make that happen, and that was my first time ever opening up to become in this advocacy world. And as I continued my journey, I began to be in, I got into VIVE, one of the models of VIVE, also Black AIDS Institute, where we was talking about prevention and care through social media with the women. Hadia was there. She was one of the women that stood alongside me and a whole bunch of other women, great, amazing women. I remember this lady told me, she was like, every step that you make from this point on, you take this step and you use it. So I did. I took the steps and I used it to continue to build and continue to walk in this walk, even though it's not easy. It's never easy. And stigmas is still out here. It's still here for people to talk about but never want to be educated. Some people are ignorant, and they only ignorant because they want to be, because it's enough knowledge out here for anybody to have. And as got a little bit older, of course, I'm sorry for the
Sorry,
long.
sorry.
I'm sorry. I'm gonna go ahead and kill it right there, because that's her that he get off. I'm sorry, it was a little too much. So I'm sorry.
It's okay. I love it's okay.
I'm sorry, man.
Because say what
Say some of it.
you have. Yeah, because I
Okay.
have another
Okay,
question
I'm
for
sorry.
y'all.
Yeah.
But I love that you like that was just a major jump from being in a space of unknown to like being in this like
Known.
full throttle
Yes,
advocacy.
absolutely.
I'm about to change a whole law in the state of Georgia that's been in existence for 20 plus
Absolutely.
years. And you know, they doubted us, but
Doubted us.
we did what we
They
needed to
definitely
do.
did.
So Aisha, same question. You have been living with HIV since birth, and you have entered the workforce in many different avenues, but when did you realize your connection as a Dandelion Lifetime Survivor intersected with your career path or the work or your journey or your relationship with work?
I guess I'll just quickly answer that. I mean, it was when folks wanted to give me a $25 Dunkin' Donut card to hear my story. When they wanted to give me a $15 gas card to talk about being word positive. So that's when I realized that yeah, that my lived experience intersects with some work in the HIV field. I mean, that's just the quickest way to get to the answer. Getting into this work it wasn't something that I wanted to do. I was actually outed and folks came and found me. And from there, it was always about my story, wanting to hear why this person outed me, wanting to talk about whatever individual I was dating at the time. Then when you find out HIV wasn't the biggest story of my life, wanting to hear more about that and wanting to come up with a reason for how I acquired HIV. So, you know, people wanting to know your business is how I really found out that my lived experience was, I guess the way I will say it is that my lived experience, you know, folks wanted to have that, know that, and not necessarily pay me equitably.
Same. Thank you, Aisha. You done brought everybody in the chat back to them $25 gift cards, baby. Cause me and D know that money used to be gone in a day. In an hour before it even reached our hands. So I just really quick want to do a time check because I know we started a little early. So Mark or Martha, what time are we wrapping up our panel, just so I could be sure?
We're good for until 10:45.
Okay, perfect. Thank you so much. Have you all, and let me start with Omar. Omar, I love that you named, you know, like we talked about, you're getting into public facing advocacy. I know you personally, so I know how you use TikTok and social media to your advantage for your advocacy. But prior to HIV related work or education that you do in your previous jobs, have you had any resources that support your mental health, your career counseling, development of your career, anything like that, starting from like even high school?
Heck no. Mm-mm.
You said heck no.
Heck no. Mm-mm. Nope. Not whatsoever. Nothing. It's actually been the opposite. It's been very difficult for me, like with jobs, because because the way I learn at a very slow pace. So jobs nowadays are very impatient. So because of the way I learn, what they'll do is they'll use the 90-day method. So after the 90 days, they just let me go and just say that I didn't fulfill like what they wanted. And like the thing is with me, like is very like I have part aside from being born with HIV, I also have learning disability, anxiety, social anxiety, attention deficit disorder, reading comprehension, and brain processing. And I sometimes suffer panic attacks, but those don't happen frequent. So like to see my disability, you have to put me in a certain situation. So like if it's a place that has like a lot of instructions, or like a place that has like if it's everything, like if it's timed or whatever, then yeah, you're gonna notice it. I'm not going to perform well. It has to be something that's the same thing over and over and over and over, the same thing every day, like the same task every day in order for me to perform well, or provide me with accommodations, which a lot of jobs don't like doing. Because the last job that I had was with an airline, and my therapist recommended like some like a recommended like some accommodations. They declined it because they felt like it was like them doing the job for me. So it's like basically, so yeah, like no, I haven't. It's been the opposite. So it's like sometimes, like sometimes like I feel like okay, like I'm not gonna be a great, like sometimes I'd be worried like in the like for the future, like I'm like, okay, I guess I'll never find a stable job because this is a problem. Like each time I get a job, it's like it don't either last long, or or they're not patient. So yeah, no. Like I will, like to like work, some,
Mhm.
but yeah, like no.
You, Omar, you definitely named what I was thinking when I read this question to myself, as far as like, I don't remember any like in-depth career development trainings coming from like high school per se. Like we had one day of, all right, y'all, make sure you have your resume. It was like for a project, dress up, interview
Yeah,
style,
yeah,
show up
yeah,
presentable.
they don't, yeah.
But it wasn't any like, you know, any work around it. Like, what am I getting into when I go to a job interview? Should I tell them I'm living with HIV if I'm working in food service? Should I not? When if I get cut? Should I call my, like any
Yeah,
type of conversations about that are not happening in our high, of course not in high school, but like even with our providers, we're not having those type of conversations with young people. Um, Kim, what about you? Like employment related resources?
Oh, no. So I think for me, I will say that I was blessed. Both my sisters are social workers. So they gave me my on the job training. They were the ones that were like, do not leave outside without a belt on. Do not, you will have on matching socks. This is how you talk. This is what you say. Um, Me showing up at that time, this is like again early 2000s, in the field. And I will say we did have somebody come in who wound up being my mentor. And I always said I was placed in the right space, the right place at the right time. Where I had Claire Simon, may she rest in peace. That's where I feel like I'm saying rest in peace too many times. Um, my mentor, she just passed away last summer, and she came in with a training. So it was just like how to cultivate your stories. And we were like 14, 15. And she gave us that training on just to how to get your message across and to tell your story effectively. And she kind of put me under her wing and taught me how to do different things. So that was my on the job training or my support. And then it was, other people like Deborah Levine, and then I had like Barbara. Again, sadly, she passed away, but like I had older women, I like Ivy, like different women in the field who were like up in like who were doing the work, who wanted to see us do it. They were my mentors, my people who like told me what to do, what not to do, how to talk, how to learn the system, what they're expecting, and then utilize that and make that work for me. So I think it wasn't an official thing like in school. We wasn't doing that. It was nobody offering up like this is how you show up. It was honestly the giants and the elders who actually was like, hey, she ain't afraid. Go ahead and do it. And my sisters, I can say that, and each other, because I think a lot of us learned from each other. Whereas we got older, we all was giving each other little tidbits where it's like, girl, don't do that. No, no, no. They looking for this. All right, here's my resume. This is what my resume look like. Put this. All right. When it comes to this, this is what you say. But I think the biggest setback for me is my mental health. I cannot. I have severe anxiety. Most people don't. When you see me in public, I'm very big. I'm very bubbly. My personality is huge. But I have to pace myself, and I'm up at 5 o'clock this morning getting ready for a panel discussion. And I'm not even around anybody. Because for me, it takes a lot, even from before of being in isolation in the sense of not my grandmother not putting me with a whole bunch of people so I wouldn't get sick. So even when I go into spaces with large groups, I shut down. I have to really like listen to music. It's a whole routine for me to show up effectively and be that person. And then as soon as the job is done, I have to retreat back. So those are tools and tricks that I had to learn for myself, for me to show up in this work and continue to do it and not quit every day. So yeah.
Yes, thank you for naming mental health. You and Omar did that so eloquently, but it's so important that we talk about mental health, and we're going to get into that a little bit later. I do want to go to one more person because Mars, you talked about you work for the state, you work in the insurance realm. I know somehow, somewhere along the way, you got some career-based trainings. Like, please reassure us.
So, so yeah, it's true. I've been at my job now for 10 years. I technically don't work for the state, but I do work on a state project. But the until that point, until 10 years ago when I got this job, there really wasn't much professional development. I went through a lot of the actions, such as the career day and things like that, applying to colleges, even taking my ACTs, which was what we did in Chicago, which is where I was raised. Taking all the state tests to get into colleges and things like that. All of that stuff was just like, I'll go through the motions to do the activity that is happening in class, but I don't actually believe I have a future. So therefore, why plan for it? So when about 10 years ago, when I moved to New York in 2011, so I guess it's been about 13 years now, 14 years. And I've been at this job for 10. I've been in my position, like in my department, for about 8. And that's when I joined learning and development, that's really when my development started. And even then, honestly, it wasn't until like my second manager within that organization that, we had structured professional development, computer-based trainings and things like that they require of like all employees, but nothing specific to like me and my path and what I maybe wanted to do. I didn't even know what that was. But I finally had a manager who sat me down one day in her office and was like, so goals. What are those? And she was like, well, where do you want to go within the company? I could maybe see you being a manager one day. And that's, like 4 steps from where I was at the time. Now I'm 1 step from a manager. But she saw the potential in me. And helped me get past my own mental barrier of whether or not the future was going to happen, and more so like, well, it hasn't, like, I haven't gone anywhere yet. And I've spent however, 20, I'm 36 now, so I've spent, 27 or something years, thinking maybe I shouldn't plan for that. And so, this manager really kind of helped put into perspective that even that was possible. And that's really what started my journey, I guess you can say, on professional development and goals and things like that. She made sure that I was given all the opportunities and all the classes and things to do that. Something that is similar to me, to Omar, as far as my learning. I've never been diagnosed with any official like learning disabilities, but learning has always come difficult to me because I basically slept through my first 10 years of school, or well, from first to fifth grade. I basically was sick and in and out of the hospital so much that I didn't get a good education. So high school was like a crash course for me of like 6 years of school in 4. Um, so it was a lot to catch up on. So for me, learning, my managers have been amazing and have allowed me to take on my own projects, because if I'm passionate about something, I'm going to get it done. And quality improvement and quality management is part of my title with my job. And it's, yeah. So I guess that kind of answers the question.
Definitely answered the question. And you named two big things. Like, one, like, why plan for it? I think we all like can resonate with you on that when we have been told our life is cut short or will be cut short. So it was like, why plan for anything? I did the same thing. I did not give a day about my time in school the way that I know if I took it more seriously, or even like my future when it came to college, I was just like, it's whatever happens, happens. I'm not going to be here anyway, and that was such, that kept me so, uh, like from reaching my fullest potential, that it's so unfortunate. And then the other thing that you named was, once you interacted or met that manager, they were able to show you what was possible. And I think we all have, and if we have not already, but we've met people in our life who has like made it click for us, where it's like, oh, there's so much possibility out there. And Kim named it beautifully when you named Ivy and your mentors, because, mine was Vanita. And even meeting another dandelion like Dee showed me, oh, it's possible. There's more of us out there, this community. So thank y'all for naming it. Raise your hand, just my panel, but raise your hand if you have a learning style that is unique to you. Okay. Majority of us do. Like, everybody's learning style is never the same. It's never linear, structured. So if you ever questioning, why is this work training not working for employees, or why, here in the school system doesn't work for certain students, we all have learning styles that are unique to us. So I'm going to switch to a different question, and I'm going to pass it to Aisha. But does your current employer know your HIV status? And do you feel like that has influenced your experience in your job and your career, either positively or negatively?
Well, being that my last 3 jobs, I have not even applied. It's literally been people of, hey, I want you here working and doing this in this way. So the short answer to that is most definitely it has impacted me positively. My employers do know my status. That has been the reason for the inquiries. When I first started out on social media doing advocacy, after I was outed on social media, I became like a peer. So basically, folks would reach out to me, come to me with questions, maybe how I handle different things, and I would just be providing them back answers. And that's how I was able to actually get my first job. And then another one, I just was speaking Wayland, DC, and an organization in Orlando. Their director, I'm sorry, not a code. I'm so getting used to code ED structures now. But the executive director was in DC. Matter of fact, to Ace Watch. And kudos to anybody who's going to be making their way there soon, advocating for people like me. So yeah, I was at Ace Watch and met a director there, and that's how I got my next job. So pretty much all of my most recent employers, and this is over the stretch of about the last 10 years, have been because of my status and my lived experience. And I started out in HIV service organizations as a peer, creating peer programs and like working myself up. So I think I answered that.
You definitely did. You honestly just showed us how something can evolve, something that somebody meant for bad turned into something good in your own benefit. And I really love that because we can get into how they really thought that they were gonna, embarrass you, but they just kind of like just jet started your career path when it came to HIV. So thank you to whoever that person is. Dorothea, same question for you. Like, does your job know about your lived experience? And is that a benefit, or has that been positive or negative in your life?
Oh, that been a benefit. That's being HIV positive, and I think the requirements when I got the job was being HIV positive and having a child within the 5-year mark. So it was a benefit for me when I received the position. So yeah, like I haven't had no problems, and also they benefit. The last thing I want to say is that they accommodated everything, far as if I get sick, we got like if I need to call off, they accommodate that. It could be the day of. Like it was just really beneficial when I got the job. And also for the people that do not know, I work at Emory University School of Medicine. For the last 5 years, I work as a clinical research interviewer, coordinator, whatever you want to spend, peer navigator for the last 5 years. However, I will be missing that job. But however, yeah, it was a benefits for me. Definitely benefited.
Thank you. Thank you. I'm going to pass it back to Aisha. I think you wanted to name something else.
I'm going to say, I feel like maybe the earlier question might have been, because in all honesty, HIV service organizations are always looking to employ people living with HIV in specific roles. I know being in community-based organizations, it was always their first choice to have somebody, even a case manager that was living with HIV. It was just the availability of that, or having people that want to show up in that space and do that work, because it takes a lot to show up and do the work, and it's also a part of your lived experience. However, I feel that working with HIV organizations has been more beneficial for me because of how it allows me to still show up in advocacy, show up for myself. And also I have the availability of having things like life insurance and health insurance that does not break the bank. Honestly, prior to working in HIV service organizations, I did not have I think for the year, my tax returns were about $13,000. I was not making adequate money at all. I was not making enough money to really take care of myself or my children. I rely heavily on government assistance, and that means having to deal with a lot of different people, a lot of different attitudes, a lot of people who feel, you know, that you're taking advantage of some system, even though the resources that you're receiving were not enough. I remember used to tell people, you know, I can't die. Like, I can't die because I can't even get insurance. I don't know what would happen to my kids. My mother died when I was really young. I had the availability of having grandparents who were well in this world and were blessed tremendously by the Lord and were able to take care of 3 kids without any assistance, where they saved our money for us that we got in Social Security from my mom, even though it wasn't much, but was able to save that up for me. And I ran through it like it was a $10 bill as soon as it got in my account. So, you know, getting into the workforce and really becoming an adult was really terrifying. And at the same time, I also was eager to ride the systems too. It wasn't until maybe I was about 25 that I realized I need to go back to school. I didn't even have a GED. I need to do something with my life. So I think I wanted to go back because I'm like, the way I answered that makes it seem like, you know, everything was just a walk in the park, and you know, everything just has been well since I have been employed in HIV, and that really has not been the case. And actually, you know, if it haven't been for working in HIV service organizations or organizations that intersect with the HIV community, I don't know, you know, that I would be in the space that I am in today, and that my children would have turned out the way that they have, because I know that every experience that you have shapes you, and they shape the 2 children that I have that are 7 and 17. So thank you for letting me go.
Of course, Aisha, and without even like force or any questions around politics or anything like that, you named a very important point, which is Social Security and the benefits of Social Security in your story. Like, you named that, you know, your grandparents received it from your mom's experience, and you know, you somehow benefited from that, even though it was a little coin in your pocket. It was still like, oh shit, I got money. And then you were like, wait, I can get more money once I get out on my own and do my own thing and flourish. But how can I do that? And how do I navigate that? So I really, really appreciate you naming that, especially while Social Security funding could be on the line. Medicaid funding is on the line. Like, you know, prevention funding is on the line. So thank you for uplifting that. D, I saw you like raising your hand, putting it down, raising your hand. So what you gotta say?
I didn't want to be rude, but the equitable pay, that like that's why. But Kimmy had already put it in there. Like, we need to be paid properly. We
Name
need to
it.
be paid properly for the work that we do. It's very important. Like, it's vital. Like, I'm tired of us getting paid crumbs off of the table when we have kids, we have houses to pay for, we have lights just like everybody else. And some of these organizations are I want to be really careful the way I say this. Some of these organizations are holding on to their positions and not giving people opportunities to be in positions. Gatekeeping, I didn't want to say it, but gatekeeping is time for us people that are younger generations to come up and be that person. We can do it. Let it said it. I want to go to the word of God, but I am going to go real quick. Let the older teach the young, and that has been forgotten about in the HIV community and with people growing up. It's time for us to get the older to mentor us, because y'all already have it locked in. Give us an opportunity, pay us equitably, and also give us an opportunity to be in a position and be in that position that you have been in. And so we can teach the younger generation behind us and not gatekeep and hold on to it. But that's all I wanted to say. Sorry.
You named exactly what everybody needed to hear. The chat's going crazy, so I appreciate that.
We need HIV reparations. That's what we need.
Okay, talk that talk. I do want to ask one more question before we open it up to the folks in the space. Mental health. Mental health, I heard Kimberly name it, I heard Omar and Mars name it. And you know, how has mental health in any way influenced or impacted the work that you do, whether it's related to HIV or outside of HIV in your jobs? And anybody can answer this. I just took a mental health day yesterday, and I actually just learned about mental health days last year. I didn't even know that was a thing. And not all jobs offer it, but if they did, and if you can convince your job or your career, or wherever you are placed, y'all need to include mental health into this journey or this work, what would that look like? How has it influenced you? And go ahead, Kim.
I am a big advocate on mental health. Think I'm one of the people that's like, guys, getting therapy. We need it now. Still looking for a therapist now. Like that's a whole nother story. But I think again for me, because HIV impacted me in a different way, my status is my experience, because I've been relatively healthy, from what they call what healthy is. But for me, it's been the experience of like survivor's guilt, losing my friends, um, going to funeral after funeral after funeral over and over, and then being closed off to new experiences with people, not trusting people because of past trauma, um, not wanting to, that depression comes in and creeps in because, we don't focus on the glimmers that we have in a day. It's more of the triggers. And for me, trying to fight through different things that you don't realize is a trigger, as something as simple as your birthday, something as simple as the season changes, Christmas, because for me, all of those remind me of different things that happen in my life. I can't listen to reggae music because that's my mom died on Labor Day. So for me, it's like again the death association, the holiday association. So when I show up in the space and I have to remember that nobody in this space knows my life. So I have to be cognizant when I don't even realize that a lot of the stuff that I didn't say are triggers. And then having to explain over and over again, that mental anguish of having to do that builds up on a person. And I think for us, all of us have that childhood trauma that we are still working through. And I just had this conversation yesterday where we might have been healed, but we're not delivered. It's still things that still come up that don't start Dorinthia, because we just had a whole hallelujah session this morning. But it's but it's something that we are still working through every single day. So give us grace, ask us if you are hiring somebody, and here's me, because I'm always going to put it in. If you're going to hire somebody with lived experience, pay us adequately, because it's not just about paying our bills and maybe being able to afford the 4 chicken wings that cost now $9 in the restaurant, but also just of the fact that that's less stress on me to think about can I live, or am I just existing with this? That adds on to that. When a lot of us have the qualifications, not just because of lived experience, but because like Aisha said, we said this isn't enough. I had, just like Aisha, getting a GED and going back to school so that way you can take me serious and then pay me for the degrees that I went to, the time, and then treat me not like the kid that you were treating at clinic, because a lot of the times everybody still sees us as those little babies who was going to die by the age of 1, and then treat us as that with our pay, how they talk to us and the opportunities. And then when we say we want to come in and we can do this job because we've been doing this job, you just haven't given us credit because we didn't know our power, then it's a problem and we're too sassy or we're too privileged when nothing that we have had, we have just gotten to us, we had to earn and fight for. Sorry for the angry tone. It's early in the morning and I'm only on 1 cup of coffee, but I'm not sorry about the message. So thank you.
And you know, I had to write down a whole bunch of your messages because I'm gonna put them on a t-shirt. I love glimmers and not tremors. Okay. And then what was the other one that you said? Oh, Martha put it in the chat.
Still not delivered.
Yes.
Yes.
Yes. That nearly sent me. I need that on a shirt. Okay. Thank you, Kim. Thank you so much. And Dee, I see you with your hand up. So
Yeah, I just want to add to Kim what she said. She's right. Like we literally just had to have one of them moments this morning when Kim, with me going through some mental stuff, like literally just had a conversation this morning. And I wanted to say, like you said, the healed, not delivered. That's a lot of stuff we working through and we trying to process through. Like, and also I wanted to just encourage a lot of people, get you a group of people that got wise counseling. Cause I listened to Kim this morning. I listened to Nettie, Aisha, like my girls come together and be like, hey, if I'm in a space, they know how to bring me back. If they in the space, we know how to bring each other back. Like, so I just encourage everybody that are positive to get the right people around you that's going to encourage you, lift you, and build you, because that's what I have around me. Enough people that encouraging me, building me, and lifting me up, even in my my mess. But yeah, that mess is a message. So, you know, I appreciate you, Kim. So yeah.
there is a message in the mess. Thank you, Dee. I love that you named that. We talked about like how much time should we give each other when we are going through mental unwellness? Because that's all it is. I don't want to call it an illness. I don't want to call it distress or anything that has a negative connotation, but it's just being unwell in that moment. How much time? And we landed on like 48 hours. Like we should give each other a 48-hour grace to, return, get ourselves back to center. And then reach out to each other like, hey, you good? I still ain't here. Okay, let me know when you're good. And we should be able to do that with each other, with peers and community. We should feel safe to do that. So yeah, let's take that out of our group and really like sprinkle that fairy dust elsewhere and see how people can utilize our methods. Omar, when it comes to mental health, mental unwellness, how has that influenced or impacted your career, your approach to your career, your journey in any way?
When it comes to mental health, I try to be calm as possible, but that's an understatement because I'm extremely anxious at all times and I try to be calm as much as I can. And I try not meditation because that's hard because of the attention deficit disorder. It's hard for me to meditate and concentrate and stuff. But I try not to get too not get too anxious. I try not to get too anxious about stuff. That's what I would say. It's a little bit hard. I'm still working on that aspect because I'm a overthinker and I'm a person that worries a lot. So it's yeah, it's very hard. And it's people keep telling me, oh, think positive, it is like it's very hard for me to like just make my brain automatically think, positive. It's like it's very difficult. So it's like, I don't know.
I love that you named, you have attempted to meditate, but it's an ongoing challenge because meditation does not work for everybody. The same way church does not work for everybody. You know, therapy does not work for everybody. You have to try out different things to see what works for you. I just learned that there is a planner and stationary items for people who have ADHD, autism, ADD. I learned that from Aisha, and I'm just like, let me get me some because I am an organizer. I'm very atypical. And I want to go to Mars because Mars, you put something in the chat that said Mac truck days. Explain that to the folks before we open it up for questions because I know we're at time.
Yeah. So quickly, Mac Truck days for me are kind of the description that I've given my mental health days, where it's like I wake up and not only emotionally but physically I cannot do the day. Like if I do, I will probably snap at somebody, and I am known for being cool, calm, collected, Mars 99.9% of the time. So if I feel like I'm just irritated and just want to scream at the world that morning, or just physically am too just way too tired and just can't bring myself to do the day in a sense as far as work goes. I call them Mac truck days. The boss that I actually brought up earlier, I had shared my status with her and I told her about these Mac truck days. And so it tended to be where I would take about one a month. But there was, I mean, I had PTO anyway, but there was always some leniency because there was an understanding of like, it's not just depression. Like this is, it's a little deeper than that for me. And on a Mac truck day, it's truly feeling like I don't have the ability to do so, and I probably spend most of that day sleeping or in bed, to be honest.
And I'm not mad at it because that's what I do too. Okay. I'm not getting out of bed. So we do not have any time for questions, but if you all can put them in the chat, any questions for the panelists, we will be sure to take screenshots or whatever's necessary to send it to everybody, to make sure to get it back to you all or back to Mark and Martha so that they can disseminate it to y'all. But thank you. I want to give a big warm thank you to Omar, to Mars, to Kim, to Dorinthia, and Aisha for taking the time out to be on this panel, to share your personal experiences, to retell your story once again, and how impactful you all are. I really, really appreciate you. So thank you so much. I hope you all go off and be well and have a wonderful day, and really take the time after this call to woosah, decompress, and yeah, remember that you all have done something that is remarkable and trailblazing to the folks on this call. So thank you. And thank you, Mark, for having us, and have a good one, everybody. Bye.
Thank you all so much. Wow. Just the powerful bearing witness to what you all had to share was such a gift. And I know that as you all express, sharing your stories and over again can sometimes be taxing, but we are grateful that you're sharing it with our community. And we do hope that there's a passing of the torch, as you all have stated. But just hearing your experiences, your thoughts, and your suggestions and resources were very impactful for us. So thank you again. Thank you to the panelists. Thank you, Antoinette, for moderating. We are going to move into our next panel. I know the day is rolling, but we're going to move into our next panel happening. And it's going to be entitled, let's see here, The Role of Employment and Employment Services in the Journey of Black People Living with HIV. And this panel is going to be moderated by Danielle Warren Diaz, who is the Community Health Program Director at the University of Connecticut Health. Connecticut Children's Youth and Family Community Health Program. So we'd like to welcome Danielle and our panelists. We're going to briefly pivot to spotlight our panelists and get started.
Hello.
Hello, and then we can remove the PowerPoint. There we go. Hello, I'm going to just add a spotlight for our people here. Let's see. See here, almost done. Let's see, did I get everyone? I think I got
Yep, I
everybody.
do believe you have everyone. Thank
Awesome,
you
thank
so
you.
much, Dr. Williams. I appreciate you. Good morning, everyone. Good morning, and big shout out to our panelists and to the attendees of this webinar. And I definitely have to give a shout out to the Dandelions. I've worked most of my career with women, infants, children, and youth living with HIV. So shout out, I definitely know your story. I know that you're a lone population, and we're here for you. We're here to root for you. We actually have a dandelion on our panel. I think this is the first time she's heard herself be referred to as a dandelion, but we're gonna have to fix that, Stephanie. So we're here to talk about, our journeys with HIV and employment, and also being Black folk, who are trying to work and have, good careers, and the journeys that we've taken along the way. We take different journeys. We have different types of employment. It's always a blessing to be able to work in the field, but that's not necessarily the case for the majority of people living with HIV. So what I like about this panel is that you're going to really get a different perspective on the continuum of employment, jobs, and career. So today we have Arthur Harris, Octavia Lewis. I called you Octavia, but when I heard your message, I said, okay, Octavia, not Octavia, right? And then we have Pastor Andre McGuire, we have Stephanie Ross, and we have my girl, Shauna Teasley, on our panel today. And I would like to begin by asking you all to briefly give us a little bit about yourselves and give us at least 2 or 3 jobs or types of jobs that you've had so far in your journey in employment/career. Arthur, I'm gonna start with you.
Hello, good morning, everybody. So the employments that I've had within the last couple of years, I worked at Hartford Hospital as a transporter. I've worked as a caseworker a few years ago. It was kind of brief, and that's kind of basically kind of what I do. I don't do it like long term, but it was like off and on.
Okay, anything else you want to tell us about yourself?
Well, right now, I went to school for human services, so that was something I furthered my career in to help people that had the virus. Also, I'm in school for massage therapy, so I've been trying to get into different stuff that helps people with their health, whether it's mental or whether it's physical. So it's HIV related things.
Great, thank you. How about you, Octavia?
Good morning, everyone. So some of my recent stints was I was a healthcare coordinator at Montefiore Health Systems in the Bronx, New York. I was I was one of the associate vice presidents at the time for a local nonprofit here in Atlanta with their community affairs and engagement. And in my current role, I am a pharmaceutical sales rep. So yeah, that has been my journey of trying to navigate employment. I will say that it has not come without its challenges, and many of them I am facing now, learning how to wear the hat of being professional with what I do, but also realizing how it impact those that live and thrive with HIV like myself. So it is not always the easiest thing navigating those positions of authority when you work with people that don't always understand how those intersectionalities show up. And so it's a constant struggle, but I am managing.
Yeah, I definitely understand. I always say I have all these hats, and I'd be like, okay, I got my consumer hat on today, y'all. You know what I'm saying? I got my director hat on. So it's just really navigating, but staying true to yourself. So I really appreciate that, Octavia. Pastor, we call him Rev, Andre McGuire. What about you? What has been your 2 to 3 most recent jobs? And tell us a little bit about yourself.
Hey, man. I guess most recent 2 to 3. I'll take the last couple. McKinney Shelter, where I was case manager in probably the largest all-male shelter in the city of Hartford. I was the program director at Human Resources Services, and I'm currently the pastor director of Arms Ministries International. Mind you, I am also retired, so I'm a young man, y'all. And I've been living with HIV for over 30 years. Initially, I didn't know anything about HIV. So my profession previously was practicing law. So I kind of had a background in advocacy. And I'm grateful for the fact that I had that background. I'm grateful for the fact that I also have that ministerial background, because it helped me to deal with some of the hardships that are presented, and it also helped me to be able to go out and fight and not really get dissuaded by the mess that people will throw at me.
Yeah, thank you for that. I know, I've been in the HIV arena for over 30 something years, and at the beginning of the epidemic, we had to rely on the Black churches. So we did have our pastors step up and publicly get tested for HIV with the mothers of the churches, and it really resonates with our community, right? The Black culture, our churches. So thank you for that. Pastor McGuire. Okay, Stephanie, what about you? What's been your little journey, and tell us a little bit about yourself.
Yeah, so basically my last few jobs pretty much have just been retail, but aside from my work in retail, I am a college graduate. I graduated from Manchester Community College with a focus in music studies. So I intend to kind of do more musical performance and things like that with my degree. And as far as my HIV status goes, I was born to an HIV positive mother. She's my birth mother. I was adopted. And I've learned over time that that my mom didn't have HIV with my other siblings, but she had it with me. So my sister, I have one biological sister that I live with. She doesn't have HIV and I do. But yeah, so it's just kind of like an ongoing journey. I've been under Danielle's care since I was a week old.
Before you were born, but we ain't gonna go back that far. Thank you, Stephanie.
Yep.
Sharna, how about you? Tell us about yourself, some of the jobs you've had in your journey, and yeah.
Good morning again, everyone. I'm Sharna Teasley, and I've been positive since 1985. I don't have any complaints about my journey. It's crazy because I've been with it for so long, being positive for so long. But I started getting out of recovery, finding my path, which I knew I always wanted to give back. Rather, it was just a community, HIV community, just give back what was freely given to me. I was lucky enough to have some beautiful women in my life, Danielle. That back then, none of us really knew much about being positive, going back to work, whatever, whatever. We just didn't know nothing about it. But I was lucky enough to have some women in my life that was help me and guide me on a path where you need to be accepted of. Because if you don't accept your demise, then you can't move on. And I was struggling for a while. But once I came over, I started off at MetLife. No, I started off at Walmart. I got out of treatment. I got a job at, well, I got my apartment. Then I got a job at Walmart. I was working at 2 Walmarts, Rocky Hill and Manchester, and going to meetings every day, every night, whatever. If there was a meeting, I was in it to save my sobriety. And then what opened the door for me to work even stronger and work towards my passion was becoming a peer support specialist. When they opened up that, they came to me with a little piece of paper like this and said, do something with it. We had a small budget. We had a couple of meetings about it, but I feel that the people that became peer support specialists, myself, Andre, and others, we ended up getting jobs to support other HIV positive people. So that a lot of part of that is where my journey started at. And now I am a client advocate / cash manager for the House of Bread Day Shelter. I run the whole day center for the homeless. I do a lot of referrals out and stuff like that. So I have to work. I'm on disability, but I have to work. They put me on disability in 2009. I was getting depressed. I was seeing the therapist more than I should have. I was doing things, that didn't make any sense. And I wanted to work. I just wanted to work. I didn't want to sit at home and wait once a month for a check. I wanted to work. So that's where the peer support specialist came in at. And then I've just been, and that was in 2009. What is it, 2025? I'm still out here.
Still cracking, right? So
Still
thank you for
cracking.
that, and talking a little bit about disability, and aside from our beautiful young folk who live with HIV, we are an aging population as well. And as the young sister said, time to pass the torch on and sit back and let them, take the reins.
Yeah.
So thank you for that, because you can work while being on disability. And it's one of the things that people living with HIV who have been living with HIV for what we call the long-term survivors, who are now becoming elderly or seniors, that it's still okay to work a little bit while collecting disability. So thank you for that, Sharna. Arthur, what impact has employment made on your life?
I think it's made a big impact overall, just helping people, with me living with it for over maybe 18 years. It kind of made me just reach out to different types of people who have been struggling with it for years and trying to give them therapy and things like that. When I had did some work within it, I didn't realize you gotta do so much with helping them with insurance and keeping up with the plans and things like that to have a stable life and things. But yeah, from stepping in from from a client to a actual worker, that's when I realized it's a lot of work for mental to help people, for clients and things like that. So I kind of think that's a big impact. The advocating, speaking out to young people. When I was younger, I would talk on panels and stuff, and just to make sure that people are taking their medications all the time and just physically doing well. So over time, since I've been 17, 18, I have been doing that. So I'm 33 now. So it has been a real shift to everything that I've been doing over the years to speak and just to reach out to any type of groups of people. So.
Great. Thank you. Thank you. Stephanie, I know that your journey is a little bit different because you've had like little, well, not little because a job, is a job, the retail jobs. What has that experience been for you? Like what type of struggles working retail job that kind of pays more towards minimum wage?
So I don't think my jobs know about my HIV status, but I still deeply struggle with like anxiety and depression and just general mental health issues. So there is that kind of level of like, I need my own type of help in my own kind of way. But essentially, like through these jobs, I've been able to support myself. My hobbies, like I said, such as playing music and like college, and being able to support my mom. She's disabled, has COPD. So I had to kind of grow up a little bit earlier on and kind of take a more important role. So having this job is kind of like, um, I don't know. It taught me things that I didn't really think I needed to know or didn't understand till later on. It taught me like the role of responsibility because I never say I'm like irresponsible when it came to things that I had to do, but I definitely it didn't become more relevant about how serious jobs and opportunities and going after them are. So yeah.
How about you, Octavia? What impact has employment made on your life?
Oh, it's made a big, big impact on my life. It has allowed me to um, gain some financial stability. I, purchased a home for my boys and I in 2023. We closed in January. It allowed me to be able to purchase, vehicles that I can help my parents out. It allows me to help my grandmother who is elderly with helping her take care of her bills because she's on a fixed income. So it has definitely allowed me a lot of financial stability. But in the process of that financial stability has come, you know, the stress factors, and especially in our current, political climate where it seems like erasure is around every corner for people like myself, particularly Black, particularly a woman of trans experience and a person living with HIV. It seems like we are being attacked on every front. And so realizing all of those things and realizing that I'm responsible for taking care of a whole household and things outside of my household, it has become very, very stressful at times. And being a single parent of two boys that are active in sports and various things, like if I didn't have a network or a community of others that are living and thriving with HIV that understood what I was going through, I don't know where I would be at. Because it takes a community. And again, it's one thing to be able to make money to pull yourself out of poverty, but it's also another thing of staying out of it. And I think that's the part that we don't understand and we don't realize everything that comes along with like staying out of poverty, and especially in this time, how stressful it is. So I'm grateful, but I'm still reminded of what is and what could possibly come.
Yeah. Yeah. Thank you for that. I mean, you kind of jumped to one of my questions, but it is, the elephant in the room for a lot of our work. Like right now, we just need to just keep moving and serving people and hopefully, be able to provide employment services and things of that nature. But with the political climate now, I think we're all a little worried about it. They've taken DEI, diversity, equity, and inclusion out of the language. So it's, pretty much erasing people who felt like they weren't there before who finally were seen, and now it's sort of like, you know, folk feeling like they're being erased. You know, a lot of work in chronic illnesses and things of that nature impact certain communities. It just is what it is, you know, Black and brown communities. So how can you you know, address it if you don't call out the people that is impacting and those types of things? People are trying to just really change the language and just wash away those things that a lot of our ancestors worked really hard to put in place. So how is everybody feeling about, you know, their lives and their work life and their survival life when it comes to the new presidential administration right now? Sharna, I'll start with you with that.
To be honest, I ain't really thought about it. I mean, what can we do? You understand? The only thing I figured is whatever he decides is what he's going to decide. I can just live my life like I've been living my life and do things to the best of my ability. Yes, I've started noticing some changes in the economy, whatever. My food source is getting a little low again, but you know how I do, Danielle. I ain't never hungry. But I kind of like, we got enough on our plate. And I say we, because we're all working and we're out here still. We got enough on our plate. And to add his crap onto our plate, we just got to take it in stride every day. If you take on that, it's going to stress you out. If I start thinking about everything that he's doing, I'm going to get stressed out. And I'm going to take it out on my clients. And I'm going to get irritated with what's going on. Luckily for me, when I first got this job, I automatically told him I was positive, because there's going to be some days, mental health days, like Dandelions was talking about, everything that them women was talking about. My boss needed to understand, I need those days. If you want me to be productive and get the job done and take care of all these people that I take care of 100 to 200 people a day. So who's going to take care of Sharna? That's why I told them, Sister Teresa and all of them, yes, I will be able not to get up some days. I may have to call out some days. You know what I'm saying? I'm learning also that I'll be 61 in 3 months. I'm close to retirement. You understand? And what I do here, they telling me they'll never let me go, that I don't need to retire. But you have to retire your soul and your mind, because I got grandkids. You know what I'm saying? I got things that I want to do. My hours are good, but, you know, come on. So to answer your question, I hope I kind of answered it. Like, I don't care what he gonna do. Long as I get my medication and I'm able to take my medication, which I've been taking the same pill for over 20 years, and it's been having me undetectable for 20 years. Long as he don't take that away from me, he can have everything else. Just give me my medication. I'll do the rest. Because I can't stress over. I heard something a couple of weeks ago about taking the funding away. I don't know if it was a rumor, but I kind of heard it, and I was like, real. It's real? Yeah, well, just don't take my medication away. And we already done lost majority of our services. When COVID hit, they forgot all about HIV positive people. So we become obsolete anyway. So yes, we need to, even though I'm here working at HOB and being an advocate and everything, I'll never stop being a peer support specialist. Never. Anytime one of my old clients come through that door, I still talk to them, treat them same way. If they need anything, I got them. Never will I ever stop being a peer support specialist. As long as I'm positive, they're going to always get that information from me. Always.
Thank you, Sharna. Thank you for your perspective, because we all have our own perspectives.
Yeah.
Rev, did you want to kind of talk about that a little bit? You know, what's going on with the political climate and work and employment services and things of that nature?
Yeah, I have a tendency to take everything he says with a grain of salt, but I deal with it from a very different perspective. I grew up in Newark, New Jersey, in the middle of the riots, and we've been through all kinds of stuff already. This, to me, is no different from the wars and the battles that I've learned how to fight already. I've been blessed to be able to grow up in a situation where pretty much nobody expected anybody from Newark to grow up and do anything or to accomplish anything. And all the folks that I went to high school with, matter of fact, we started middle school, graduated high school, most have graduated from college, most have advanced degrees. And all of us will take a stand when something's not going right. I sit up and I kind of laugh because I'm wondering why nobody understands that this man is violating his oath of office. Because when he took that office, he swore to uphold the Constitution of this country, but he's been dissecting it ever since, and nobody has said anything. But again, I'll be from a different perspective. You know, the thing that also stands out in my mind, but and I'm talking about as it relates to HIV, I'm a part of a group. Matter of fact, Straight and Positive is a group that I've joined. That's heterosexual men. And I wound up joining that group because, unfortunately, the same battle that I have out in the world dealing with some of the stuff that he's doing is a battle that, as a heterosexual Black man, I've had within the HIV arena. And it has been a battle. Trying to get a job, trying to find anybody that want to support anything that's related to heterosexual Black men. I tell everybody the truth of the matter is I'm present, but I'm invisible almost everywhere I go. You know, and I mean, I'm talking about the stigma conferences. I'll be at the AIDS Watch. I'm looking at everybody's agenda for the things that they want to deal with. And the one thing that's certain on all those agendas is heterosexual Black men are excluded. Unfortunately for our community, we know that women, for instance, Black women, they will be 70% of the persons that will be newly diagnosed with HIV. We also know that 70 to 75% of those women say they got it from a heterosexual Black male. But Department of Public Health says they can't find any heterosexual Black men diagnosed with HIV. Something's wrong with that picture. Obviously, there's nobody doing any testing of heterosexual Black men. If you test them, you'll find it. But those things are important to me, particularly when it comes to employment. I've actually sat down and watched people, many people, because I guess initially they'll say, well, you know, it's probably because you don't have the education. You know, that's why you don't get certain jobs. And I don't say anything to them initially. I just look at them like they're crazy because I have an associate's, I have a bachelor's degree, and I have a Juris Doctorate. So I'm pretty sure my education is rather sound. But I've watched many people with they have high school degrees. Some may have a bachelor's degree, but I've watched them come up with six-figure jobs when, with the knowledge and experience that I have, I can't find anything. You know, and it was a 3-year span that I was jobless. You know, I got to admit that I came from a different perspective before I acquired HIV. I was practicing law, had my own insurance, did everything else. When I acquired HIV, I was still dealing with it because I had my own insurance and everything else. But I wound up going to prison. And when I came out, I had to find a job. It was horrible because everybody wanted you to go through a wash, rinse, and repeat job employment situation. Well, we're going to take you in here and teach you how to teach you interviewing skills, teach you about writing a resume, give you this certificate or that certificate. And then when you get finished, you still won't have a job. You know? So for me, that's a complete waste of time. We need somebody or people surrounding us who's going to take the time to talk to us, to identify what our particular needs are, what our particular capacities are, and funnel us into jobs that are directed towards the experiences and the knowledge that we have. I was listening to the Dandelions earlier, and I felt bad for Omar because I'm saying, all right, I know the battle he's going through. Everybody else will be able to find a job a lot easier than he will because he's a Black male. You know, and at some point we've got to start recognizing that and start trying to lift him up to give him the information he needs. I think I was really, really blessed to have developed the relationship ministerial that I did because it allowed me to have hope in spite of being constantly slapped by people. You know, it allowed me to be able to stand there and say, you know what? The one thing I can always count on, because I've been through some stuff in life, God has brought me through it all. So even with this, he's capable of bringing me through it as well. And he has. I mean, from jail to 3 years later, case manager, program director, and the arms ministry that I've created is created specifically because we've got to get up and fight our own battles because nobody's going to fight them for us. You know, they started out in the beginning saying there's nothing for us without us. But then they expect for us to not remember what they said. There's nothing for us without us. If you do not see me there, trust me, I'm going to be raising hell. And y'all can excuse my language. And I know I might sound a bit, but that's because I'm passionate about this. You know, if I don't take my experience, my training, and put it to use to help somebody else, then I'm not worth my salt. So as far as I'm concerned, I'm gonna do what I need to do. And you may not like it, but that's gonna be all right because I'm not doing it for you. I'm doing it for me and for other people that are like me. So
Okay, all right, that's strong advocacy. So my next question is about employment and mental health. And I heard even in the Dandelion session, and I've heard it a couple of times here, you know, as far as mental health is concerned, you know, in the journey of working, and I'm gonna start with you, Arthur, because I know that one of your jobs is not really in the HIV arena, but you've moved up pretty well at that position. What does that do with your mental health? I mean, if you're having mental health issues, just working in the regular corporate world, do you feel comfortable addressing? And I heard people say in the Dandelion say, you know, I'm gonna take a mental health day today. Do you have that luxury at that job?
But I'm actually currently working at Home Depot, and usually I don't have the luxury at all. So I usually go through a day by day. Like recently, it's been a few years since I've been going through like depression and anxiety. And when it's time for me to like try to take some time off and stuff, I can't really do it, or you know, I either get penalized for it. So I have been like going to therapy and things like that, and also like recently with the passing of my father, so I didn't even get a chance to like really grieve. I only got like 3 days to really.
My condolences.
Yeah, so it is difficult to like come to work every day and all that's going on too. It's like it can mentally take a toll. I feel like you're drowning, but you still gotta get up, you still gotta go to work, you gotta make your money and do what you gotta do. But I try to like, just utilize stuff that I like to do. Like therapy, it can help as much as it can. So all I have to do is just be strong. I can't be weak and like, I would love to take a day off and have some time for myself, but it's not really possible. So that's really all I can say about that.
Yeah, yeah, and thank you for that perspective because in the day of really trying to nurture people and consider mental health and and wellness for folk who are working and especially those living with HIV. Not everyone is going to be the majority of the jobs that are out there that people hold living with HIV. They're not given that luxury, so we need to remember that part. When you work in the human service field, people are a little more apt to think about those kinds of things and say, okay, we understand that staff and employees need to be able to take care of their mental health in order to perform well, but that's not necessarily so in the world of work. So thank you for that. Octavia, has working at any point in your journey had an impact on your mental wellness?
Absolutely. Like I tell anyone, I working in the social service field, because that's where a lot of my experience come from. When you engage with people, you necessarily are not meeting them when you first meet them, you're meeting their trauma. And the same thing with a job. It shows up as well. And so for me, I have done a good job with learning how to compartmentalize things. But let me say, there is nothing wrong with showing when you are not your strongest. I feel like we do a disservice to ourselves when we say that we can't show up certain ways. I express all of my emotions, whether that's anger, whether that's rage, whether that's being sad, whether that's being mad, because all of those are human emotions. And I am a human. I am not going to be happy all the time. I am not going to agree with everything all the time. And so I think that we have to move from that conditioning of you have to be on all the time and you have to show up 100%. That's a lie. I'm not doing that to myself. I learned to extend grace to myself when I am not at my best. I have to let myself know that I am still worthy. I am still, deserving of, having a space made for me. And so I think that we have to learn how to have that empathy for one another because it's easy to get caught up in the oppression Olympics of saying, well, oh, woe is me, or oh, this, I had it worse, or I had it harder. I think we all have had, some worse days and gonna have some worser days. And I think that we have to acknowledge that. And we can hold space for that and let each other know that just because my circumstances may not be like yours doesn't mean that I am less than or I am less deserving. Because there have been plenty of times, me as a woman of trans experience being in cis women spaces that I know that, okay, this is not my fight, but I can hold the door open so that other people can fight. And I think that we do a disservice for one another when we don't hold the door for each other. Because oftentimes we get so caught up in, well, what about me? And no one is making this space for me. We have to look at where our intersectionalities intertwine with one another because nothing that, if we look at this system was not designed, created, or implemented with none of us in mind. And when we don't take the time to make space for each other, because we're worrying about, well, wait, I haven't had my time. Wait, I haven't had this. Or wait, you're getting too much of this. Yes, there are some of us in this movement space that take up entirely too much space. Let's own it, let's name it. There are some of us that, again, we're not giving the opportunity to have our voices heard. Why? Because people are too busy talking themselves. I don't believe in people being voiceless. I believe that you're not being quiet enough so that you can listen to other people. And so for me, it is about listening to other people. I know that my liberation is not going to come from me fighting alone. I know my liberation ain't going to come from me staying up in my house. I know my liberation ain't going to come from me having insurance on a job. My liberation is going to come from making space for other people that come into the space along with me because I don't believe in being the only one. I don't believe in being a pick me. I believe that it takes all of us with all of our strengths, all of our opportunities to be able to get us out of, to get us or move us into the right direction of liberation.
Yeah, thank you. Thank you, Octavia, for that. It's, that collaboration, that, holding each other up, that, that intersection of just coming together and just, voicing, the needs of people is just really important. And it's actually important to our mental health in this journey on these jobs. I'm on my third generation of folk. I had the grandmas, I had their kids who were born with HIV and they're having kids now. And we buried a lot of babies and mothers and grandmothers. And I remember the first child I helped a family help bury. She was 3 years old. And she was dying from AIDS. This was back in the 90s. And she looked like she should have been under a Christmas tree because the casket was so small and it was white. And then they had her in white. So I helped, and she was with the foster family. Mother was 17, and I'll never forget that. But during those times, we had pastors come out to have visuals with us. We did candles, we did aromatherapy, we did all of those things, not only from the grief of watching people in the early years dying from AIDS, but just for those of us who lived with HIV and not really having any medications or medical intervention, but we wanted to keep working, you know, at least I did, and be an advocate and be there to hold this child, because babies with AIDS didn't feel skin. And I just wanted them all to feel somebody's skin. The hospitals were scared to touch them. So this is where we used to be. And it was when mental health had to be considered in order for us to get through, for the people we served and for the people as like ourselves, living with HIV. It was the only thing that was going to get us through, and so some of us survived, some of these babies survived and are having their own children. We got our dandelions, we got our people getting old, like Sharon about to retire in her 60s. And you have to address the whole person, right? With everything, not just with health, but also with employment and career.
And Miss Danielle, let me just say this one last thing. I think, and also the systems that be have taught us to operate from a scarcity model. And a lot of them want us to feel like, oh, it can only be one of y'all. And I think that we have to push back on that system. There have been plenty of opportunities that have been allotted to me, but I've also had to make space for other people and to be able to let other people's narratives be heard. And I think that some of us do have to do a better job of making space for one another. And some of us are still in that scarcity model mentality where we feel like, nope, it ain't gonna be no other opportunity. And I think that we also have to move beyond that as well.
Yeah, most definitely. Thank you for that. Now, I know some of you have, kind of found your own jobs, taken that journey of employment, seeing who's hiring and just going for it yourselves. But I think two of you have actually used employment services. And, I'm proud to say that, I've been involved with a collaboration in our area. It's HOPWA in the Hartford area, which is, for those who don't know, HOPWA is Housing Opportunities for People with HIV and AIDS. And it's a collaborative effort with our Hartford Transitional Grant Area, Ryan White Part A funder, as well as the national, with Mark, your agency. So we've come together to really put a program that really specifically address people living with HIV who want to work, want to get busy. It could be volunteering because, we do have an age population and they're retired, but, might want to make some little coins on the side, just really taking people from where they are. And I know two of you have used it. I'm going to start with you, Stephanie, because I know that you've used this employment service for people with HIV in our area. And I want you to tell us what your experiences has been with a specialized employment service, as opposed to when you were just out there trying to just find some work. What has that done for you?
Well, for starters, without these services, I'm looking and probably finding opportunities that aren't right for me, not because they're bad jobs, but they just don't match my abilities and my skill set and complement my potential. But with the services, it's just like, you get introduced to the people who you need to know, where to ask. And then when you're meeting with these people, it's just like a closed mouth doesn't get fed, essentially. So, they encourage you to ask questions. And I feel like without them, actually, my job now, I work in retail, but I had got this job through the employment searches and all that kind of stuff. And it kind of just really helps me to get settled so I can have peace of mind while I kind of, after work, focus on myself and kind of like still create, my next step, where do I want to move to next. So it's really been transformational. I don't think I can kind of picture my work background without these services. So I think I use them pretty much for the whole thing, minus like one job, maybe two.
Yeah, and I know that, your employment counselor now is trying to help you get into some type of employment around music, right?
Yeah, actually, it's kind of funny too. When I met with I think it was through Mark's program, when I met Jill and Tamara, they had a good foundation, kind of helped me set up some goals to kind of slowly but surely kind of get ahead, like one step at a time, in terms of like how I'm gonna get to where I want to be musically, even just the first steps. But it's so funny, at my housing worker, I get housing assistance through the Ryan White program. They have a new employment specialist, and he actually does music for a living. And it's so funny, he's my childhood best friend's uncle. So it's kind of like a full circle moment. Like, it's just, I don't know, it just, it's just nice to see a community of these people. And just like Octavia was saying, it's like we're nothing without community. We're better when we're amplified with other voices. So it's empowering, you know.
Yeah. And I know that you will be working and making coins in the area that you're passionate about. And that's so important, and that's music. So I'm glad for you and that you're taking that journey, and you will reach it. Pastor, Rev, what about you? I think you've used employment services in the past, correct?
Yes, I have. As I mentioned earlier, it was not easy dealing with employment services initially for me, particularly because they had an idea of everything that they wanted you to do. And a lot of it really had no application to me at all. And it was extremely difficult. The thing that I wound up, I think I had on my side was I had a desire to go to work. So when the American Job Center, which is up here, when they opened up at 9 o'clock in the morning, I was there. They closed at 4 o'clock and I was still there. And people are like, why are you always here? Well, while I don't have a job, my job is to look for a job. And so I was there. And as a result, though, a couple of ladies, Jill is one of them, that worked there, saw me there every day. And they came and they said, look, we've looked at your resume and you wrote your resume better than we could have written it. So it doesn't make sense for us to be trying to push you through the normal channels. Give me your resume. And when I go somewhere and they're looking for a job, I'm going to give them your resume and tell them to call you. That's how I got the first job. The blessing is I also was a part of Hopway at that time, and nobody was really doing anything as it related to workforce development. And I'm really appreciative for the program that we put together. It's employment development. We started off, it was being done through Hopper because they allow you to do some employment development work there. But there was a PCN policy clarification notice that went to Ryan White Part A, which will allow them under certain circumstances to do the same thing with certain individuals that are employed to do it. So we have a group now with persons from the American Job Center, persons from Hopper, persons with lived experience, persons from various sectors that we know. We're trying to pull in somebody from DEMAS, which is mental health and addiction services. And for those that don't know, I also had to deal with the addiction services thing. I'm 32 years in recovery, and that's a blessing, but we needed to pull all of those people in so that when they talk to somebody, they talk to them from a person-centered perspective, not trying to dictate to them based on some plan that they had set in place to make sure they stay employed, but trying to talk to them from a perspective that's going to help the people that they're talking to get a job. I had to learn a little bit. There's a difference in quality of life, and sometimes we struggle with that. When I was there in prison, we had a cell. It was about 8 by 9 with a toilet and a sink and 2 bunk beds, and that was the space. When I first came out of there, I had a studio that, and I said this before, I thought I was George and Wheezy. I thought I was moving on up, I thought I was doing something. And then after I saw the rats fighting the raccoons and the cats in the backyard, and the guy downstairs beating somebody in the head with a golf club, and the guy in the hall shooting up with needles, I'm like, yo, What am I doing in this place? That's why I need a job. So I can be responsible to get a place, a better place to live. We're talking about now in this climate, they're trying to take all kinds of money away. We need to be preparing the people that are coming in to live. Not just let them come in, get them a $5 gift card, $25 gift card, and say they ain't starting no trouble. So I'm just happy to sign off on all this stuff. No, we need to prepare these people to live to the best of their ability. Whatever their capacity is, we need to allow them to experience and to reach that capacity. So, and I hope I didn't talk too much, but
Thank you, and thank you for your passion, for sure. One question that I have, and I want all of you to think about and address, and that is, we have counselors on here, we have vocational rehabilitation folk here, just a gamut of providers who can connect people living with HIV to employment and careers, and education and things of that nature. What advice would you give those counselors or folk who work in that arena when it comes to working with people with HIV in terms of helping them with employment and career paths? Like, what would you say to another person who could help someone take a journey through employment and careers? Arthur, I'll start with you. What advice do you have?
I would just say take your time with them. Like, what they want. I just say take your time.
Yeah. Patience, right?
Yeah.
Very good. Octavia, what advice would you give?
We are not a monolithic community. We are all not going to get to the same place at the same time. Some of us are going to walk, some of us are going to take a taxi, some of us are going to take the bus, some are going to ride a train, and some are going to get on a plane. So just know that our journeys are unique to us and that models have to be catered and centered to the individual. Because again, one size does not fit all.
Thank you. Rev?
I would say don't give up. It sometimes can be really frustrating, and our mind can say, nothing's going to ever happen for me, and we can just quit. But your blessing is just right on the other side of where you are. Don't give up. There's always, I didn't think there was anybody that was going to be out there to help me. And just as an example, in recovery, I never asked anybody for help because I was never taught to ask anybody for help. And from my experience, wasn't nobody gonna help no way. But I came in and actually said I had a problem, and I was amazed how people came to help me. We may not be used to doing it, but don't give up and don't be afraid to share your story. Because if you never share your story, nobody ever knows you need help. So don't give up and don't be afraid to share your story.
Great, thank you so much. Stephanie, what about you from your perspective? I know you're not that long ago out of high school and just finished college. What advice would you give a counselor, or someone working with someone with HIV who want a career?
So I would say not just listen, but hear us also. And just like Octavia was saying, it's like one size opportunities don't fit all. You got to kind of be willing to extend the other options available to those of us living with HIV. A lot of people would like to tell you where they think you should be placed because what your status is, what you look like, what you are on paper and off of paper, but you kind of just gotta not really go above and beyond, but you gotta go outside of that box. You gotta take some options outside of those places.
Yeah, thank you. That reminds, because I do that, honestly, because I'm like, okay, you need to work in the HIV field. I tell all of the kids that, right? Take this test, but not everybody is really meant to do that. I remember saying this to one woman. She said, because I don't like people like that. I said, okay. So yeah, so to really take people and who they are into consideration, right? When they're guiding them.
For that, you know what I mean? It's good to kind of encourage them to do more than what they feel like they can do, but just letting them know that there's other options beyond that too, that, you know. So you're not wrong for that, because trust me, I do it to other people without realizing it. My mom does it to me. You already know how that goes.
Yeah. Thank you. Sharna, what would you advise a counselor who is working with someone living with HIV as far as helping them with an employment or career journey?
I'm back up with what Andre say, what Pastor say, like being patient with us. I know with my situation over here, it's crazy because my boss about as old as my ass is, and he did not know nothing. It's almost like he didn't even know about nothing about HIV. When I first revealed to them, because I feel like I said before, I went through the work program through disability, SSI. They had a work program for people on disability to go back to work. That's what encouraged me to go back to work.
Okay.
And then that's right around the same time where the peer support specialist came in, the project came in. So it just blended right on in. And because I was able to work and it accommodated, the peer support program accommodated us and our time and what disability would only allow us to have and things like that. So, and it doesn't affect me at all. So I would just say to my peers, if you're comfortable within yourself and you're comfortable enough to let them know, because if it's a job that you really, really want and that you really love and you know that you could bring it to the table, fight for it. Fight for your position. Because when one door closes, another one will. Peer support closed their door. 5 weeks later, I was hired as to run a day center. So always just stay positive. That's about it. And then just they need to be patient with us.
Thank you. Thank you. Thank you all. Thank you, panelists. I do want to address just one question that I saw in the chat. And no, no one has to disclose their health situation, whether it's HIV or anything else. So I just want to answer that question. That's a resounding no.
Yes.
So thank you, panelists. You know, you all were great. And I know if there's any other questions that come up afterwards, we'll be able to address those at another time. But I was told that our session is over.
Thank you all so much. I mean, I just feel like there's so many gems of knowledge that are being shared, and also resources and support that I know for our students and probably for many on this call as counselors or future counselors need to know in order to best support this community. So thank you so much. Thank you, Danielle, for leading this very informative panel. And we're rounding the curve towards the end of our time here. We do have one more dynamic panel, and then we're going to have a closing and evaluation. So without further ado, we're going to keep on moving. Again, we're going to encourage you, if you need to, take breaks as needed and come back with us. We're going to move on to our final, last but not least, panel for today. And this one is going to be highlights from a 2025 research literature review project, studies related to HIV and employment. And this is going to be moderated by Martha Cameron, who we've heard from earlier on this morning, who again is a research specialist at Georgetown University and a director for the International Community of Women Living with HIV North America, and a commissioner in Washington, D.C. for the Regional Planning Commission on Health and HIV. So we're going to quickly spotlight all of our panelists and then pass it over to Martha for our final panel of the day.
Yes, thank you so much. Oh my gosh, it has been an amazing day. Those were really like two amazing panels. I'm so privileged to have seen the dandelions. I think that was really amazing information that they gave us, including really giving us the torch or asking us to pass on the torch to a new generation. And then, of course, the amazing panel with Miss Danielle. I think that was just really informative, especially for the people who are going to be doing, counseling and vocational rehabilitation, to just hear about the different perspectives. Thank you so much. So we're going to move into this panel that I'm really privileged to moderate, and that is highlights from the research literature review that has actually been commissioned by the National Working Positive Coalition. And the simple reason for this has been that there is such a dearth of literature. There's very little out there that specifically zeroes in on people living with HIV and employment. It will sometimes mention it as a barrier, as we will hear, but very little that has it related to quality of life. I have been so privileged. I joined the research working group for the National Working Positive Coalition when I was working with Mark, and I have been allowed and really privileged to stay on. You're going to hear from the amazing folks listed on the screen, Jen and Liza, who are actually the co-chairs of the research working group for the National Working Coalition. And then Atia, who is actually from Canada, Pabord, who recently joined us here in the US, and Sangwon, who is our powerful moderator, if I can say, for the literature review project that we have. So I won't go into, I think some of our bios are going to be shared via the slides. We don't have too much time, so we'll keep it moving so that we can maximize our time. Next slide, please. And we can move on ready to the next slide. I kind of shared. So I think we've already said this. We'll run through all the panelists. I will be watching chat. And so please feel free to add a question so that you don't forget it. And then, of course, we'll be sharing the slides and links after as well. So please move on to the next slide. So just a little bit about the research working group. I mean, it was established in 2003. That's interesting because that's when I was diagnosed in 2003. So it's been there over 20 years. And I think you hear a little bit more from Liza, who was a founding member and has been with NWPC since inception. And really the goals for this are to advance research on HIV, vocational development and employment. We support interdisciplinary collaboration. So you find people that end up being a part of this or end up being invited, coming from all kinds of different disciplines. And of course, the idea is to specifically inform HIV and care and prevention policy development. Last year, when we had an Office of National AIDS Policy, we were really privileged to have, people that headed the national ONAP to come and visit with us. We have had people from the CDC come visit with us, and all this so that we can actually inform some of the policy related to HIV care and prevention as it relates to employment. Next slide. So I thought this would actually be better for us to hear more sort of at the end in terms of our activities. But I know this is something, maybe you want me to pass this on to Jen or Liza to share a little bit more about this?
Okay, sure. So yeah, we don't want to take too much time, but our research working group have been working monthly together to collaborate with researchers across the country and internationally. So we often present together at this type of conferences, trainings, but we also do some research project. For example, recently, Mark and Liza presented at the White House Office of National AIDS Policy convening. It's called Enhancing the Lives of People Living with HIV. Currently, we're doing this lead review project, and we also collaborate with CDC Medical Monitoring Project. The next slide also shows some of our past completed project. If you can go on to the next slide. Yeah, so I won't go in details, but I'm sure we're gonna send out our slides to everyone, and there is a link within each project. So if you're interested, you can take a look at our past project and yeah, connect with us if you have any interest in collaborating with our research team. Thank you. I think we can move on. Yes. Martha, you are on mute.
You'd think we would have learned this by now. Thank you. So we are going to be talking about HIV and employment models. And this is really just a brief overview of kind of what you will hear. But I think the idea is to think about this in the context of how HIV service care and delivery is provided. I think you've heard a lot from the dandelions and from the previous panels about what it really takes for different people who are living with HIV to just overcome some of the stigma and discrimination that is related to their lives, overcome the challenges related to their health, and then eventually consider working and the different counseling, mentorship, and sometimes, quite frankly, just angels we have in our lives that end up, linking us to employment or things that can help us be employed. And really, I think the foundation of this is to see employment as a key to the quality of life of people living with HIV, right? That a lot of us that are living with HIV are living in poverty and under the poverty line. I think you heard from the Reverend how he went through these stages to where he wanted a job. And when he wasn't working, his job was to be looking for a job because he had realized that in order to have quality housing, quality food, he needed to be employed and needed to have quality employment so that he just wasn't living in areas, that were rat infested, as he shared. Why are the models needed? Well, they really help us explain these complex structures. I mean, you just heard about how complex the reality of the lives of people living with HIV are. And yet, because they're done in various contexts, those models are sometimes incomplete or they are limited. And so we'll hear from the panelists today. We will review the benefits and limitations of key models, and we will look at how research can highlight the directions, not just for future research, but also for policy and then practice and implementation, right? One of the things that motivated us to do this was the fact that, a few years ago, employment was actually, quality of life indicators were actually placed into the National HIV/AIDS Strategy, and employment was one of those things. And yet we can see that there's been a struggle of how does that get implemented? How does that get funded, supported? How does this get communicated to our community? So without much ado, I will pass it on to our first panelist, Fabod, I think, who's going to talk about one of the first models.
Yes, thank you very much, Martha, and thank you for having me. It's an honor to share this platform with my esteemed colleague and the amazing panel. So can we go to the next slide, please? Yes. So I'm going to talk about the client-focused considering work model that was by Betty Kohlenberg and Peter Goldblum, were the first to propose a framework for addressing the employment needs for PL-HIV, people living with HIV, in 2005. The client-focused considering work model presents key guiding principles that are critical to incorporate into HIV services and policy. As noted in the name, it's a client-focused approach, and self-determination is a critical component of the model, which means individuals do have a choice in the decision-making process. It also incorporates change theory, which is applied to phases of the considering work process. This model proposes that the need to consider changes in employment status comes from pressure in 4 key domains, which will be discussed in the next slide. And understanding the different stages of considering work can inform what interventions are essentially needed. And it's important to note that people can reconsider the decisions at any point in the process. So now we're going to have an overview of the model. Martha, thank you very much. So this is the considering work model that is designed to help people living with HIV make informed decisions about employment. The need for vocational decision-making comes about when there is a pressure for life change in these 4 domains of influence that you can see on the left, the colorful circles: medical and psychosocial, that can be emotional well-being, financial and legal, and vocational factors, that is like something like career aspirations. This model emphasizes on a client-centered approach that recognizes that employment decisions are dynamic and influenced by changing life circumstances, as they do. There are 4 phases of considerations, as you can see. The first, starting with contemplation, and that's where clients assess the feasibility of the decisions to change and essentially weigh the pros and cons. Then comes preparation, which is when individuals assess decisions and make plans for the decisions that they want to consider. The next is action. Now, how to achieve these set goals that they have considered. And finally, resolution, to either adapt to or to accept the decisions or the status that they take on. The outcomes can include choice to work, not to work, or to consider any viable options that they have. We should also bear in mind that this model's flexibility allows for reconsiderations of decisions over time, and one can move back and forth through these phases, any of these phases. And also it's important to note that people can consider their decisions at any point of the process. Additionally, it recognizes that changes in life circumstances can impact decision-making, and access to information is critical in decision-making process, as it poses a unique focus on the need to have access to vocational information as a key factor for quality of life. So Martha, can we go to next slide, please? Thank you very much. Now we go through some of the benefits and limitations. So as you see, it is an individualized and dynamic process. As it emphasized earlier, it is a client-centered approach which focuses on the individual choices, and it recognizes that these choices can very well change as the mental health and life circumstances alter. Considering work models supports flexible work frameworks and strategies for people living with HIV. And it also focuses on self-determination and informed choices as integral foundation of this model to reduce employment-related stress. However, we will have some limitations to this model. As you see, this model focuses on self-determination, always intended to improve the impact of employment on quality of life. However, quality of life wasn't included as a formal outcome. Also, it does not account for broader cultural and systemic issues and policies. Therefore, there are work to be done and improvements to be incorporated in this model. Thank you.
Perfect. So we'll keep it moving. Thank you for that, Farbod.
Yes, the next one, I'm Sungwon Lee. I know you can call me Sungwon if you have any question. And the next model is a socio-ecological model. As the Farbod mentioned about the considering work model, and then one of the limitation mentioned there was about like the model itself is actually, with the approach, individualizing the people living with HIV's experience and journeys and employment and career. And the social ecological model itself is the model coming from a lot of critics on the like traditional developmental psychology discourses. You can think of like, all the conversations around parenting style or like how it affects children's like life or something, but it's limiting to the individual perspective anyway. So the model coming from that, critics, and it has been used as a framework that can help to understand the multiple factor impact individual behaviors and outcomes. So originally it was conceptualized and revised by the multiple scholars in different fields. And the students might recognize the Bronfenbrenner, who is the most famous person in this model. And also a lot of other scholars have been engaging in this, like in developing this model. And the particularly for the people living with HIV's employment and the career development, Mosby and colleagues, like in 2020, their team try to use this model to like understand what kind of factors like determinants are related with the people living HIV's employment experiences. This is the original like Bronfenbrenner, most famous model people might see in the textbooks or like in the like other websites or resources. And you can see that at the center of this circle so is starting from the child, like because like this model originally coming from developmental psychology. So child with the people like surrounding the child and the interactions, like the relationship. And then the another system like exosystem, like also affecting the like not directly to the child, but like people around the child is affected by them, and it's indirectly affecting the child's wellness or like mental health or development. So like multiple like circles, like layers and levels, like they try to address in this model. We can go next slide. And then this is the Mosby. Their team try to pull all the determinants and factors from their scoping review, literature review, and try to place that in each circle, each level of the model. So starting from the individual model, like, demographic, health status, employment and education, and like knowledge, education, attitude, belief, and practices at an individual level, and coming from that, like interpersonal level, like social support system, organizational level, work environment, community, and policy goes up to there. So it's showing that each level, how the factors can interact with the people's experiences in employment and career. We can go to the next slide. Yes. And when you're thinking about that, multiple level coming from the individual, because like, as a counselor, traditionally we've been focusing on the individual, which means like we are working with the individual. We try to focus on how they're understanding, try to like help them in a like one-on-one situations. Like so a lot of conversation and the theories, models in our works, our roles has been highly focusing on our practices in a one-on-one individuals counseling sessions. But it has been also expanding in our field. So now we are seeing the counselor's roles as an advocate, as a part of one of the important role as a change agent. So this is the model by the American Counseling Association called the ACA Advocacy Competencies Domain. And I can give a little bit of explain on that because when the counselors look into the system like ecological, social ecological model, they tend to feel lost and know how to deal with all the larger level, like broader level in their practices. We can go to the next slide. So I borrowed the Mosby social ecological model to explain a little bit about how the counselors can play a role in this multiple system. So in the individual level, according to the ACA advocacy competencies, so the upside and the downside is the upside is about like when we're working with the actual client in the clinic. And the other side is like when we are not working with the actual client, but we can still advocate on behalf of the clients or our future clients. So for with the client in the upside, like in the individual level, we can empower like them in our practices, like listening, validating, showing the empathy, being present to and showing them how we are understanding their situation and helping them to connect with like being aware of their understanding their own resources and resources in the community, and then going up to the community level by collaborating with community partners and members, connect them with the existing programs or services, and going up to the collective actions, like if we needed to change more in the institutional level or like policy levels. And then on behalf of the clients, we can also do the advocacy from the client's level to the systems, and then also going up to the social political like arena. So we can go to the next slide. So the benefit that we can have from the model is about like if it's giving us some ideas of how helping us to understand how the individual and then environmental factors are interacting in a multiple levels. But the limitation here is going to be it does not specifically focusing on the health or quality of life outcomes. So it might be difficult to see like how these can be connected to the certain outcome that we might interested in, let's say employment and career.
Good. Thank you so much, Simon. And Jen, you are doing the Anderson's behavior model.
Yes, good afternoon, everyone. So next, I'd like to introduce the Anderson's behavioral model of health services use. This model was originally developed in 1960 to understand use of healthcare services, but now it has expanded to a broader range of determinants affecting healthcare access, health behavior, and health outcome. So although employment is not included in all areas, but it has been recognized as one of the factors, Liza and our other working group members have utilized this model to frame research related to use of vocational rehabilitation services and the impact on healthcare services. Can we go to the next slide, please? So this is a diagram illustrating the comprehensive and nuanced understanding of how individual and population health behavior and health outcome. So for the contextual and individual characteristic, they all have three factors: predisposing factor, enabling factors, and need factor. So predisposing factor meaning demographics, social structures, health belief. Enabling factor meaning the resources that facilitate or hinder access to healthcare, such as personal resources, family, community resources. Need factor means the actual need or perceived need for health services. Perceive will be like the individual self-assessment, their self-perceived need for healthcare. Evaluating needs will be the healthcare provider's assessment. So I would like to ask you all a question. So if you think about employment, which factor do you think employment will belong to in this diagram? You may type in the chat. Either predisposing, enabling, or need factor. Which one do you think employment will be in this model? Don't be shy. Just type one word in the chat. Need factor. Somebody say need factor. Anybody else? So I'm thinking about in this model, we are still thinking about health outcome, how employment will play a role in their health, right? Okay, many people say, oh, okay. Bill, would you click on the icon? Just click one time. Yes. Yes. So when we say employment status, it could be predisposing, like their current status, how this related to their health behavior, right? For example, research have shown that people who have worked full-time, they are more likely to access to healthcare benefits. So they are more likely to utilize health services and have better outcome. However, I agree with you. Well, could be both, could be all, right? Because, for example, employment services, is it available in the community, right? Or is it the person's perceived need for using the services, right? So that's why this model can also be used to understand employment outcomes and use of employment services. Would you go to the next slide, please? Yeah, and don't click yet. Oh, yeah, that's fine. Yeah, stay here, stay here. All right. So now we're using this model to understand people with HIV's use of employment services and employment outcome. So another quiz, everyone. I know you're all tired, but as a teacher, I like to quiz my students. So quiz again. For contextual characteristic, predisposing factor. What kind of factor could be included in predisposing factor within contextual? I'll give you the example. Bill, would you click once? HIV stigma. So an example would be HIV stigma could be a predisposing factor within a contextual domain because in different culture, in different society, HIV stigma can be perceived differently, right? So it's one of the predisposing factor. Any other thoughts? Race, violence, that's right. So racial discriminations, violence, inequity, these are all predisposing factor. Disability, yes, that's right. Enabling factor, can you click once, Bill? Yes. So enabling factor within the contextual characteristic include employment services and employment policy. So for example, are the employment services HIV friendly? Are they tailored to unique needs for people with HIV? The previous panel did a great job talking about some unique needs for people with HIV, right? However, a lot of services, a lot of programs may not be able to address these unique needs, right? So there's a research show that people with HIV are more likely to engage in employment services if they believe the service will tailor to their need and will lead to stable, well-paying jobs. So the available of services is very, really important. The next is need factor. Can you click? Yes. So workplace discrimination, healthcare provider support, also very important. For example, a lot of time the HIV healthcare provider may not be able to discuss their vocational need with their participants, right? Okay. Yeah, I'm running out of time. Can you click on next one? So for individual level, predisposing factor could include work history, employment status, and education. If somebody have a stabilized employment history or an education background, maybe they are more likely to have a better outcome, right? It's just easier to understand. Can you click one time more? Yeah, enabling factor including disability benefits, health benefits, and accommodation. A lot of evidence show that people may be worried about losing their benefits, including health benefits and also other disability-related benefits. So they may choose not to work because of the benefit issues. The next one, yes, need factor, including their personal career goal, motivation, and functional capacity. They may not be having a goal working full time. They may be thinking for my current health status, it's better for me to work part time, you know? So it also depends on personal preferences and motivation. Can you go to the next slide, please? So for this model, it's very practical and can have some policy and intervention recommendation to improve employment services utilization among people with HIV. For example, how to address predisposing factor. A lot of you already mentioned there may be racism, maybe sexism, otherism existing, right? So can we have some specific HIV specific employment services? Can we have culturally competent services and outreach, tailor multilingual needs? Tailor people from minority backgrounds, right? Strengthen enabling services such as providing benefits counseling, integrated support services such as housing, mental health counseling, child care, tailor health services. So a lot of people living in rural area or maybe due to HIV stigma, right? They may not feel comfortable or not accessible to employment services. So telehealth counseling will be important. Lastly, how to respond to need factor, perhaps utilizing motivational interviewing to help people understand their vocational goal, understand their health-related concern, and also address workplace accommodation. The previous panel discussed about disclosure, right? Some people may be afraid of disclosure, but they may not know their legal rights. They may not know how to disclose and how to request reasonable accommodation. Okay, lastly, healthcare provider engagement. Thank you. Do I still have time?
You've run out, but I'll give you 30 seconds to do this slide and then we'll move on to Atia.
Okay, so sorry for overtime, but the benefits for this model, including it recognize the employment in the health outcome. So in the past, a lot of models may not link directly for employment with health, but this model recognizes the importance of employment in health behavior, and it has been expanded to understand vocational outcome and use of vocational services too. So it's a very practical and useful model. However, similar limitation with the previous models, lack of discussion on quality of life outcomes.
Yeah.
Okay, that's it for me. We can move on.
Thank you so much. Yep, and we'll move on to Atia. If we can move on to the next slide. Yes, there you go.
Yeah, okay. Thank you, Martha. So it's Tia Khan. It's a pleasure to be here, to be presenting, and to be a part of this wonderful team, literature review team, and to be a part of the National Working Positive Coalition. So my model for today is the HRSA model. So the HRSA stands for Health Resources Services Administration, and the HIV/AIDS Bureau HAP Quality of Life Framework. So I'm just going to try to be brief, not take too much of your time. So basically, the HRSA Quality of Life Framework is a model that provides the guidelines to the HIV/AIDS Bureau. The Quality of Life Framework provides the guideline how to provide services to people who are enrolled in the Ryan-wide HIV medical care services in the United States of America. So what do these Ryan-wide services look like? They provide outdoor ambulatory care, primary health care, and the HIV treatment and the supports that people need. So this model is consistent with the revisions or the updates or whatever the evidence is in the research was provided and how those changes have been integrated into the national HIV strategy. So this framework aligns with that, and it focuses on improving not just the medical outcome, but the overall quality of life of people who are living with HIV/AIDS. So we see all the positive sides of this model, but we do see that employment services have not been fully integrated into this framework. So I remember Martha was speaking a while ago about how there was a discussion around employment, but that hasn't really it's been seen through. So on this slide, you can see the HRSA Quality of Life Framework. The figure shows you what the different domains are. So a little bit about the HRSA, what that does and how these services are catered to people who have HIV/AIDS and who have a low income, who may not be covered by health insurance. So HRSA provides them with these supports and treatments. So they have HRSA the qual have been categorized into these 5 different domains of how services are provided to individuals. So we have the physical, emotional, social, environmental, and structural domain. So if you look at each one of them individually, so what comes within the physical domain? So we have people who can access services where the ART treatment adherence is provided. They can come in to get their dental services. And if they need rehabilitation, they can do that as well, and primary care as well. Under the emotional domain, we see there people can access services if they want to get their depression screened, anxiety screened, or if they have a substance abuse history or they're using substances, that screening can be taken care of as well. And if people need some kind of a psychosocial support, that's there. So trauma-informed services are provided. Looking at the social domain again provides social services. So social services and support are provided through peers. So peer support, peer navigation, so peers can help others navigate through the system. And also a lot of information is provided. Those resources and are provided as well. The environmental domain focuses around trying to prevent homelessness. So people who don't have adequate housing, these services are there to help them find shelters, or even some form of more permanent, not permanent, but at least some temporary housing. Transportation to emergency or to a medical appointment is also covered. And if individuals need any financial aid for emergency purposes, this is not like a proper income, but that is also provided. So structural domains is more about processes and policies. So briefly, we can think about if some individuals need any help with the legal system, they don't have access to food, or there's food insecurity problems, they can get access to food banks and even have meals provided to the home. Let's move on to the next slide, please. So when we were doing our literature review study, what did we find? So our literature review was looking at HIV and employment it was a systematic review, and we all had our portions that we were working on, and even looking at each other's portions as well. What we found so far is that there was not a single study that was looking or using the HRSA model. And now when I went out there were several studies that were looking at the HRSA model, but for other purposes, like for primary care, but not specifically looking at HIV and employment. But then we looked closer. We wanted to find out what the truth was. We did find that several of the articles did have variables that we could really kind of put them into these little boxes, like physical domain, emotional domain, social domain, etc. We could do that. And here we can see some of them, and I can just pick one or two. For example, we have the neurocognitive evaluation screening. So I could kind of fit that into anxiety screening and depression screening. And again, there's stigma, self-esteem, and discrimination. I had several people speaking about stigma. I remember that. And I think in general, speaking about stigma. Social support, we have housing, residential stability, vacant housing, homelessness, the same issues, and food security as well. So we'll move on to the next slide. So I'll just wrap it up. This is my last slide. So what are the benefits? Where are the benefits within this model? So we do see that this model does talk about or it tries to establish an expectation to include the quality of life measures. So a little bit what the quality of life measures are about. So according to the Healthy People 2030 definition, a multidimensional self-determined construct that include but is not limited to physical, mental, emotional, and social health and well-being of an individual. So the HRSA quality of life outcomes take this definition into the building block. But the downside of this model is that it doesn't fully integrate the importance of employment services within the framework. That is a significant gap. Thank you so much.
That was great, Atia. And so I'm not sure if Liza has joined us. I know she was having some issues.
Yeah, I'm here. I'm
Oh,
on my phone
awesome.
and on my computer just to make sure. But the
Okay.
next person is Deshna, and then I'll wrap up.
All right.
Hello everyone, I'm Deshna and I'm really happy to be here. I'll be talking about the Illinois Work and Wellbeing Model, which provides a framework to link employment with overall well-being, particularly for people with disabilities and chronic health conditions. While the model has not been applied to people living with HIV, it has informed research on conditions such as MS and stroke. Like the considering work model, it takes a person-centered approach, acknowledging that employment is deeply interrelated with psychosocial and medical outcomes, something that a lot of panelists before us highlighted. It also integrates the International Classification of Functioning Disability and Health Framework, the ICF framework, viewing disability as a dynamic interaction between health conditions and contextual factors, which really broadens our understanding of disability and rehabilitation. So as you can see, the model consists of three important domains. The first one is the contextual domain, which includes personal characteristics such as personality, interests, values, identity, and environmental factors such as discrimination, cultural attitudes, access to services, and even technology and transportation. Next slide, please. The one before this. Thank you. The career domain focuses on developing vocational identity and skills across different stages. So starting from building career awareness and job seeking skills to maintaining steady employment. And the third domain, the participation domain, extends beyond employment and covers independent living, social integration, and community life, all elements that contribute to an individual's overall well-being and quality of life. Now, the benefits of this model are that it highlights the importance of work to well-being and underscores the need for integrated services that enhance community inclusion. However, like I mentioned before, it has not yet been applied to people living with HIV, and it also does not place a primary focus on vocational decision making and stages of change in the vocational process. So, in other words, this means that it lacks a structured focus on guiding individuals through career related changes and choices, which is really important for tailoring interventions for people living with HIV. Thank you.
Well, thank you, everybody on the panel, and Martha as our fierce leader, and to all today who came today. I'm really excited to be here. I co-chair the research working group with Jen. So I'm just going to summarize and give you some thoughts about share our thoughts that after going through the synthesis of the literature, how we're thinking we can draw upon the various models to propose a new considering work and quality of life model. So this is missing the client focused, which would be part of the model's name. And mostly we wanted to address the inclusion of looking at not just the impact of employment services on employment outcomes, but also including health outcomes and quality of life outcomes, as well as having a broader socio-ecological framework. So next slide, please. So I'm just going to give a kind of a brief overview of the direction we're going in, just to stimulate some further discussion. So one key factor is that we wanted to include a focus on decision making, because we know that people with HIV are not given enough opportunities and access to information to even think about or engage in the decision making process. So we begin with that pressure to change, and we have the same kind of domains. What we're working on moving forward is helping to the original model just has these broad domains, but as you saw in the Anderson model and other models, they characterize things as with their role. Are they predisposing? Are they enabling? So we're working on pulling that out to give more definition to the model. And you see here, in contrast to the original model, we have a whole section on the socioecological factors. And that's important because especially when we consider the many different populations impacted by HIV, we know that interpersonal, organizational, and especially community and policy has significantly different impacts depending upon the group that's impacted. So we can see this model also then being clarified further to address unique needs of women, unique needs of transgender individuals. So there's more that can be developed along those lines. We can retain the phases of considering our work, I think related to what many of the panelists are saying. You know, you can't just push people in or give them a one choice or you do these series and you'll get from A to B. And one thing that's kind of missing from this, we see a few arrows, but it's very much back and forth that, you know, somebody can be in the contemplation stage, decide to get preparation. When they go through some job training, they may think, oh, I really need to reconsider this. So this model retains all of that. Then we see there's a range of vocational services that would address a range of needs depending upon what phase of considering work you may be in. And then really critical, I would say, are the last two columns. One is that the employment resolution just isn't, do you have a job or not? We make a distinction between secure and insecure employment. And that's huge, as many of the panelists talked about today, that some jobs will not actually lead to positive health outcomes. So we really need to consider the quality of work. And that highlights also that this model can also be applied. We're kind of talking about it as, you know, not working to working, but it also can be applied to people who are working and want to reconsider. And I think I forget the name of the person. I think it was, well, anyway, I won't waste time on that, who was talking about how she went through a series of jobs. And now she wants to, you know, she likes her job, but she still has a broader dream of getting more involved in the music industry. So that could be considered, well, you know, it's not permanent for her where she's at. So maybe she's going to want to reconsider from a point of employment and go through a similar process to look at how can I get a job that would further enhance my quality of life. And so really most importantly is this final column that really talks about the inclusion of quality of life as an outcome. So if we're thinking of vocational services, we're not just thinking, did you get a job, but we're looking at the impact of that job on your health outcomes, your perceived health, and other quality of life factors. And just to conclude, the idea is also in the title that historically we just haven't even as especially within the policy world significantly considered both work, and we haven't considered quality of life. So it's also a request. So the full title is the Client Focused Considering Work and Quality of Life Model to emphasize the self-determination. But we're also asking, and we want to propose this model to give policy and government officials a chance to see how employment, to connect the dots of how employment can be connected to quality of life, health, and HIV prevention. So I'll end on that note and welcome any questions for the panel as
Yeah.
time permits.
Yes, we do have a few minutes, Liza. Thank you so much for bringing it all together. And really, thank you for leading us in this work. I think that is going to have very important policy implications because they've been talking about employment for a long time, but just, I'm not sure there's a real understanding of a model within which they can work to help us in response to everything that we heard today. There's an immediate question in the chat that I think would be really important to consider, just based on even the environment that we're in. And of course, I'll continue to look out for more questions. But there's a question about how any of these models, and I know you mentioned trans folks, but any of these models specifically helping trans and gender diverse folks living with HIV, and especially if they live with disabilities, who may be discriminated against because of their gender identities, especially when you think about the context that we're in, where there's been executive orders that have really targeted the trans and gender diverse communities. Does anybody want to respond to that?
I can give an initial response, and I'm happy for others to chime in. But I think that, first of all, I just want to acknowledge how painful and horrific and horrified I am about all of these attacks. And I do think that underscores why we want to pull in the socioecological framework, and why I think like having a broad model can be a helpful, just lay out broadly some of the connections between health. But I would see a follow-up to these being like taking this framework and then making it much more specific to trans individuals. And really then, now we just talk about these broad domains, psychosocial stigma, that kind of thing. But if we were to make it, if the next step to make it more specific to trans individuals would be labeling the very specific policies, the very specific challenges and types of stigma, and make it much more focused on those unique needs.
Right.
And also, we welcome folks who want to join the research working group or who'd like to work on in that direction. So I'll just put that invitation out there as well.
Yeah. Board, I know you have worked even in a different country and setting. Do you have any lessons that you might share related to that?
Well, thank you, Martha. So yes, I have worked for over 15 years in Southeast Asia and Malaysia, in particular with marginalized community when it comes to HIV and AIDS. So marginalized communities in different parts of the world can be described differently. However, you can see that consistently that LGBT communities and are usually under attack and targeted by the conservative authorities in different systems. And unfortunately, I share the sentiment with Liza that this is a horrifying time, and it requires people to come together and advocate. And I would like to emphasize on the power of allies. It's not only the community that is directly affected by the issue, it requires the whole society together to come and hold hands and support each other and advocate for the rights and redeem ourselves as valuable members of society, because we're all valued and we're all equal, regardless of all differences in any status that it might be. So, yeah, thank you.
Yeah, well said, well said. Jan and Sangwan and Ati, I know you all have done previous research in different areas. Please feel free to contribute to that.
Yeah, so I agree with Farbod and Liza, and that's really true that we all need to come together as a force. And I did hear from some of the earlier people who were presenting before us. They were talking about advocacy, being an advocate, speaking out, trying to form these allyship, trying to form these groups and speak up. So even in other countries, I know even if there are certain laws that exist, but people are eligible for all these services, regardless of who they are or whatever they identify with. And I think this is what it should be. We should go forward from there as well.
Awesome. Thank you so much. Deshna, Sangwan, Jen, last few minutes, I just wanted to give you each just at least a final contributing word.
Sure, thanks, Martha, and everyone. So earlier in my part, I mentioned about HIV-specific employment services. Another thing is we also involve in peer-led employment services. So we have seen the effectiveness of peer workers. So the earlier question about transgender individuals or other minority individual, I was thinking if they seen their role models in the community, and if they were served by their peer providers, they will be empowered. They will see there's great resources, great role models out there, and they may be inspired, be encouraged to join the workforce. So just my 2 cents.
Thank you. Sangwan?
I do have, can you guys hear me?
Oh, yes.
I do. My question is, part of being an American and then seeing these other countries, how they deal with this, and I'm listening to like Forbo being down in Asia and different places. It really comes to mind that you would think that we are like a melting pot, but I see that there are different groups in different countries that have uphill climb to gain access and be able to be successful in their in their goals and everything. So this is very interesting to listen to you guys, and I've been like advocating for people for quite a long time. And I mean, I'm a counselor here for the state, but we get all types of cases, and it really is counseling work because everybody's individual. They have their individual challenges, and it's really interesting to hear different takes from different parts of the world that really is a worldview that we all kind of share. So I'm very happy to really hear that and see where you guys are coming from. And I mean the diversity and that we all going for this same goal of looking out for each other and helping each other and finding true happiness and giving the people that you care about something to look forward to and those types of things. And this is really interesting. This is more than I thought that I'd see today, and I'm very happy to have been a part of this. Thank you.
Thank you so much. Thank you. And I love the idea that you bring out how, different diverse, folks are impacted in different ways. And we could talk all day, including about how the fact that the faith community, which is, primarily had responded in sub-Saharan Africa, have also been impacted, right? The effects of what is going on has been indiscriminate, so to speak. And so when Fabod talks about allyship, in this country, some of the trauma that we have received as people living with HIV, and I think the pastor was talking about it, has been religious trauma. And some of the hate that we're seeing is really rooted in has ideological roots that I think are even misrepresentative of the faith that they say that they represent, right? Hate just cannot be aligned with any kind of faith that usually promotes love and compassion and acceptance. It's really, counter anything that we've heard. And so I think it's really important in the moment that we're in to recognize and really be awake to these things, because I think that is what will promote allyship. That's we're all in this together, and we really need to stand together to fight against what is happening. That I personally, who is from Africa, and like Fabod is saying, we've only seen this in other countries. This kind of authoritarian and almost. Well, let me stop there. But yes, we stand together, we respond together, and the counselors and vocational rehabilitation people that are on this call are really critical to this.
And I just hope that this is I hope this is one of those things where when something seems like it's bad that's happening really avails an opportunity for us to really go forward and make some positive changes that are more
Always.
concrete on the long term. I just hope that we all have that type of faith and a way for us to really prevail and get this right, because as human beings we really need to get this right.
Yes. No, thank you very much. There's always opportunity since something around. Dashna, I wanted to give you a few seconds to put in your 2 last cents, and then we can close out our panel.
I'm just listening to everyone speak, and all of the models that we presented today, they just provide a starting point for understanding the complexities of employment and well-being. But real change only comes from advocacy, like so many people said, and education and systemic reform. And it also requires amplifying the voices of minoritized groups. So, which is why I am extremely grateful for this space and for everyone who spoke today.
Absolutely. Well said. Well said. Thank you so much. And Atiam, did you say some final comments?
Yeah, I'm just so happy to be here. So I was here right at the beginning, and I heard from all these earlier presenters from the dandelions, and some of those stories really, really made me emotional. And I mean, when I heard about how people went through and how they progressed through their life, how they didn't give up. So I heard so many stories that people just didn't give up. I mean, they're just so persistent. So being persistent is very important. So we need to persist and continue whatever the situation is, whatever is against us, but we need to continue to advocate, to speak out, to continue to struggle. And yeah, something good will come out of it.
Yeah. Thank you so much. And so as I'm handing over back to Dr. Regina and Mark, I just want to thank each and every one of you for everything that you've done. And I'm really looking forward to what will come out of our literature review, and that it will really help, hopefully, our administration or our counselors or everybody working to this just make, the lives of people living with HIV better. Thank you so much.
Thank you so much, Martha, and to the panelists, the researchers, for sharing all of these pertinent models. I feel like I was writing down each and every one because I'm very excited to share it with my class, so that they can be aware. I think that engaging in this level of advocacy through research and findings is very important. And so I thank you all for just taking the opportunity to share this. And I'm really excited to see where it goes. And I even love that you all presented an opportunity for anyone, whether you're in an academic space or not, to join your research team. So thank you for that as well, and everything that you've shared. And I wrote down systemic reform, advocacy, support for minoritized groups. Like, all of those things are very important in this sense. So thank you all for that and for your time. All right, well, we're wrapping up our afternoon, but before we do, first of all, thank you all so much for being here. I want to emphasize the importance of us receiving your feedback through our evaluation survey. This will only help us to make this even greater time after time, but also just to get an idea of how you reviewed today's information in today's Training Institute. So if you could just take a few moments of your time to fill this out, we would be extremely grateful. You can scan the QR code, or you can also check the evaluation survey link in the chat that Mark posted. Again, we would be so grateful. And if you're someone who is looking for a certificate, either for CRC or NBCC credits for today, then we would need for you all to fill that out as well. So thank you in advance for your feedback there. All right, next slide. If you're looking forward to continuing the conversations or wanting to get more information or continue with the network, these are ways to connect with the National Working Positive Coalition listed either through the website, through social media, or through email. And last but not least, we are in deep appreciation for the extraordinary contributions of the individuals listed on this slide. Thank you, thank you, thank you for making this a phenomenal and successful event, for your support throughout the years for previous training institutes, and just for continuing to do the work and to spread the message. Sincerely, from the bottom of our hearts, especially through both the NWPC and through the NCCU Counselor Education Program, thank you so much for everything you've done to make this event a success. And that is our time today. Thank you all for being here from the beginning to the end, or for those who were able to come in at some point. We hope that you take this information. I hope that it's giving you much insight, not only to lived experiences of people living with HIV, employment needs, mental health support, and also just amplifying, elevating voices for people doing the work and passing the torch and research that's going to come out of this. Thank you all for listening and being here, and we hope you have a wonderful weekend. Have a good rest of your afternoon.
Thank you, everyone. That was great.
That was awesome.
I closed down my facility.
Nice.